This is NHS Crisis Your Say. I'm Sarah J. Mee with a special programme here on Sky News this afternoon, getting your views on the state of the health service. Hospital waiting times are the longest in history, with thousands of surgeries cancelled as the health service struggles to cope. Ambulance response times are the slowest on record, and crews are spending entire shifts parked outside hospitals waiting to offload their patients. A poll suggests a third of people are unable to book a GP appointment, and the 111 phone service is facing unprecedented demand. With the NHS on its knees, industrial action is spreading in a deepening dispute with the government. Do you support the striking workers or completely disagree with their action? And if you have a positive story to share, we want to hear it, whether you work within the NHS or you simply want to praise the treatment you've received. We want to hear from you this afternoon. To have your say, you can call us 0208 167 2200, and you could be on air with us this afternoon. Good afternoon, this is NHS Crisis Your Say. Today, Sky News is launching a year-long project with analysis from two leading think tanks to find solutions to this crisis that is gripping our National Health Service. And this afternoon, we are taking your calls. We want to hear from you. It's a real chance to share your views about what is happening to the health service. Before we get into your calls, plenty of you lining up to speak to us. I just want to introduce you to our guests that will be with us for the duration of the afternoon. We have Roy Lilly with us, health policy analyst and former vice chairman of West Surrey and North East Hampshire Health Authority. Alongside Roy this afternoon, Dr. Ellie Cannon, GP and author. Welcome to you both. Don't forget the number to call today if you want to speak to us here in the studio, 0208 167 2200. There'll be plenty of reminders of that number on the screen throughout the programme for you here on Sky News today. Right, let's hear from you. First on the line today, we have Victoria from Horsham. We're going to be talking in this section about waiting times in the health service and the experience you have if you are able to see one, if you're able to get access to treatment. Victoria in West Sussex, his father died in hospital after waiting 5 months to be discharged. And Victoria, thank you so much for calling in to speak to us here this afternoon. Talk to me about what happened to your dad.
Initially, it was about 7th of August. I sort of went to his flat and found him in a bit of a state. So I called 999 and they were there literally within half an hour. So, you know, that was a great positive. They looked after him. They took him to hospital. And he had some stomach gastric infection that was causing him to be quite poorly. So they kind of gave him antibiotics and fluids, and that was all okay. And then I was told, you know, your dad can go home, but he is quite frail, so he would need some sort of care package to go home with. And that never came. And this went on, and then he kind of got COVID a couple of times. He'd never had it before. He'd always been really careful, so that was disappointing. And then he got over that and again was ready to go home again, and then again, no care package. And then just before New Year's, he got like a proper flu. So he was isolated into a sort of separate room. We could still go and visit. We did sort of usual PPE and everything. And then the flu went to his chest. He got a chest infection, and sort of the first week of Jan, he developed pneumonia. And he passed away on the 6th of Jan from pneumonia.
Oh, well, Victoria, first of all, I'm so sorry for your loss. But just listening to all of that, your father was waiting for 5 months to be discharged from hospital. He originally went in with stomach problems.
Correct.
And then he died in hospital from unrelated matters from what you've been saying.
Yeah.
Talk to me about how that happened. You mentioned a care package and that wasn't able to be put in place. Now, I know what a lot of people may say to you, Victoria, just out of curiosity. You know, your father clearly had family, had you. He may have had other members of family. Why couldn't he go home? What kind of care did he need and wasn't being given by the NHS that made him stay in hospital for 5 months?
He needed very sort of intimate personal care. So he'd lost control of his bowel after having this gastric infection. So he was wearing sort of incontinence pads, sort of like almost like nappies, really. and he also had got very frail. He had a lot of muscle wastage while he was in hospital. He was having some kidney problems as well. He was kind of waiting to see his kidney doctor all this time, so they were desperate to get him home. So, because there were other symptoms, he was quite anemic. There was other problems, just things that, you know, unless you've got specific medical training, it's not something that just a family member could pick up. And he needed sort of care with everything, you know, getting up, his personal care, washing. Where he lived wasn't really suitable, so that was another thing. But they couldn't get him moved somewhere more suitable until he was home, and then he could be assessed. So everything was kind of pinned on him getting home with the care package, and he then would have been moved to they call it like an extra care scheme, where they have nurses on site that live there. They have walk-in wet rooms, so his bathing would have been easy. He could have done that himself, but where he lived, he would have needed help with pretty much everything. I work full-time. I've got 2 children, so unfortunately I wasn't able to, you know, give up work to kind of give him that care. And there's also, you know, there's just things that I'm not medically trained to do. Yeah. So I didn't really feel like I could have provided that for him. So he was ready to go home. You know, I think it must have been about 4 times I got the call to say, oh, Dad can go home, but we need to wait for the care package because he does need care, probably 3 times a day with his bathing just before bed, and also to come and sort of help him do some food. I could have done the lunchtime just to give him some food, but the other personal care, I just wasn't able to do that.
Yeah, no, Victoria, it's important to say that, because obviously that is something that's said a lot when people say, well, why do you need a care package? You have a family that can look after you, and you've given us the bigger picture. It is not that simple. Ellie and Roy, you were nodding along to what Victoria was saying there. And Roy, I think you whispered to Ellie, we hear this a lot. This is a common problem.
It is. And Victoria, I'm so sorry to hear that story, but it encapsulates really the problems that we're facing now. And the NHS did its bit as much as it could. And then, of course, it can't look after people when they're in their own homes. That's the difficulty that we've got. Yeah. And so we look to our partners in care, which are organised by social services. What you were wanting was a package from domiciliary care. Domiciliary care and the care sector generally has about 160,000 vacancies at the moment. And getting the care packages in place is super difficult. And that means then, of course, that person is in bed in a hospital for much longer than they need to be. Something called deconditioning takes place where they get worse.
It makes you vulnerable to things like flu
Exactly.
COVID.
And as much as the hospitals try to avoid that sort of cross-contamination, it's really very, very difficult. And at the heart of this, at the heart of most of the problems that I'm sure we're going to hear about this afternoon, is the Victoria example, where actually what we need to fix is social care. And I'm sure Ellie sees that every day in her practice.
Yeah, in your practice, you must hear that a lot from families who, you know, you're a first port of call as a GP, then that patient may go into hospital. And, you know, people always say it's difficult to get into hospital, it's difficult to get into GP, but actually it's difficult to get out of hospital.
Absolutely right. And people talk now about patient flow, so flowing from primary care with me through an ambulance, through a hospital and out the other side. And it's out the other side, as Victoria's described, into social care that is causing such a problem with people. And it's incredibly upsetting as well from the human point of view that this was, you know, the end of your dad's life, Victoria. And I'm so sorry that that's sort of how everything played out. And as Roy said, you know, hospital itself is not a good place for people to be. It's great when you're acutely unwell, and my hospital colleagues sort people out, but then to sit there and not to have family around, and deconditioning, as Roy said, allows, unfortunately, this very sad end-of-life situation to play out. And what I think we'll also hear this afternoon as well is this story could have been different in another part of the country. We have a postcode lottery. There could have been a different social care issue somewhere else. There may have had better staff. And actually, it's not a homogenous system, and this didn't have to happen.
Yeah, Victoria, thank you so much for speaking up for your family, your dad and other families like you who are going through the same thing in the National Health Service. Anastasia from Leeds is on the line now. Anastasia has cerebral palsy. And Anastasia, you've been on the NHS waiting list for nearly 3 years for treatment.
That is absolutely correct, and I feel absolutely infuriated. I feel like I'm losing the will to live, to coin a phrase. I mean, as you said, I've got cerebral palsy, but what I'm concerned about is that I've got this. I will say it because it puts it in context. I have it's not easy to say, but I have a urological condition, and I just want it fixed. And I'm not receiving any social care. I'm not receiving any support. Unfortunately, I come from a care background through no fault of my own, because my mother put me in an institution at the age of 2 weeks old, and so the support isn't there. I have to fight always myself. And in fact, I was once called up for the appointment, because I will say that Botox isn't only for, as you know, it's not only for cosmetic reasons, and to have this procedure and a second time, and they said, "Oh, we didn't realise that you had cerebral palsy." So they don't actually get their act together. We need joined up thinking. It varies. I've lived in many areas in different areas throughout the country. It all often depends on who you speak to, and I don't feel listened to. When it comes to social care, it depends on whether somebody has the ability to do the assessment or not. And even if you do have an assessment, then you don't necessarily get your needs met. So you know, I don't know what to do. And what worries me is the fact that the situation for me and for others can actually get worse. You know, I believe that my condition is getting worse and worse and worse.
And Anastasia, I can hear how upset you are. I just want to go to Dr. Ellie on at this point, because, look, Anastasia is at her wit's end, waiting 3 years for treatment, which will be, no doubt, Anastasia, correct me if I'm wrong, classed as non-urgent. I mean, you know, there are 6 million people currently waiting for treatment in the UK. Anastasia making up that number. What advice would you give to Anastasia? Because she doesn't feel like she's getting any support, any help.
I would say it is urgent. I mean, I'm not.
I'm sorry, Anastasia. I meant by the NHS they would class it as non-urgent, but of course it's urgent to you. It's affecting your life.
So I would say a couple of things. I mean, first of all, speak to your GP and make sure the referral has gone through. I know that sounds ridiculous, but we're all human and we're relying on sort of technology as well, and sometimes referrals don't go through. So definitely make sure, see what your GP can do in terms of the referral. The other thing is speak to PALS, who are the patient advocacy service within hospitals, and see what's happening with your appointment, and see if you can make sure, because obviously, as you've rightly said, you know, this isn't just a health problem that needs fixing. This is a health problem that needs fixing that then affects your employment, your quality of life, what care package you need. And actually, if this was sorted out, then you would probably need less help from elsewhere.
Yeah.
Exactly.
This is a system problem. And, you know, we call them interfaces, where one bit of the service joins up to the next bit. And it's like people trip over the joins in the paving stones on the patio. They trip over the joins in the services as well. And it's so often that you get these service interfaces that let you down.
Yeah. OK, let's bring in Anil from Birmingham, who's on the line, who is a big fan of the NHS and is disappointed that it's got to this place. Anil, tell me what you want to say today.
Well, basically, I feel the institution itself is absolutely magnificent. Most countries are jealous of NHS. And the present government, for the last 12 years, has not funded it enough, because it seems as if they want to break the system up and privatize. And privatization just means shareholders make money instead of the NHS serving the people. Look what's happened in the USA. I was involved in surgery. First, in 2008, I had a heart attack, and the treatment I received was immaculate. The ambulance got to me within 5 minutes. Okay, I had surgery last November, quite serious surgery, over my prostate, and the nurses literally worked their guts out. And to now say to them they don't deserve a pay rise, it just beggars belief that we are the 5th richest country in the world. And we can't afford to pay our nurses a salary they can live on.
If you're just joining us here on Sky News, we are discussing the state of the National Health Service NHS crisis. It's your say today. We're handing the programme over to you. Get in touch with us, 0208 167 2200, whether you work within the NHS or you've had experience recently using it, good or bad. We want to hear from you. We're exploring everything that's going on in the NHS service at the moment. That was Anil from Birmingham, who is very complimentary of the NHS and received great treatment. Let's speak to Tony from Preston. He is talking about physio appointments. The waiting times are ridiculous, Tony. Talk to me about why you need one and how long you've been waiting.
Well, I've been playing sport for over 60 years, and since 2003, I've had 3 new hips, an ankle fused, a cartilage out, and tendons done in my shoulder. And I've never waited more than a month to be seen, and never waited for more than 3 months for an operation with 4 different surgeons. I had an Achilles injury on the 3rd of October, and I'm basically struggling to walk. So I went to my doctor on the 8th of October, and I was offered a physio appointment on the 14th for the 5th of December, which was over 2 months later. I couldn't get a physio appointment at the local hospital, so I got a call with a private physio, an appointment for the 4th of December. On the 4th of December, they then said, we're cancelling your physio appointment and we can offer you another one on the 17th of February. So it's took 4 months to get an appointment, and I don't know whether that's going to go ahead. In the meantime, I needed a scan on my ankle. So I only got my scan last week, which was the 17th of January. 3 months to get a scan. It's absolutely appalling. And I'm now waiting to see a surgeon. So I rang the orthopaedics at my local hospital, and they told me it could be 2 to 3 months. And after that, I would get an appointment for an operation in either 12 to 18 months. So if I'm lucky, I'm going to get an appointment or get something done in my ankle, and it's going to take 2 years to do that. I've paid into my taxes for 57 years. I need to be active for my own sanity and mental health. It's doing me no good at home, and I'm so disappointed with the waiting list now. It's absolutely terrible.
Yeah, Tony, you won't be on your own in that 2 years to get your ankle sorted. Like you said, it's your physical health, it's also your mental health. You want to be mobile, right? You can be mobile. You're just being made to wait for 2 years. But it's actually made you go private, hasn't it?
Well, I'm seriously thinking of going private now. It's not in my principles, but I'm struggling to walk, and I just can't put up with this any longer. So, you know, when you've paid all your taxes, you should be able to get an operation like I've had for the last, 20 years, as I told you. I've had 6 operations with the NHS, and it's been absolutely superb service. But now I can't even get the scan, can't even get an appointment with a surgeon, and certainly it's going to be too long for me to get an actual operation.
Roy, why isn't someone like Tony prioritised? Because, you know, I suppose you don't want to compare ailments or, you know, anything like that, but, you know, you might look at an ankle and go, well, it's not urgent. But again, for Tony, like Anastasia said, for these people, it is urgent. It's affecting their lives.
See, for everybody, it's an important thing. I mean,
why is he not getting an
you can't make a comparability, you know, between people and their troubles. I mean, Ellie, I'm sure will talk about an Achilles tendon. I mean, it sounds to me like that needs to be dealt with more urgently than just waiting for a scan. But the situation is this: the NHS is like a big production line. You know, sick and poorly people go in one end, and hopefully happy and fixed up people come out the other. And it doesn't take much to disrupt that production line, and that's what's happening here. The production line is bunged up because we've got people in hospital that we can't get home. We don't have enough staff on the wards. The NHS is still struggling with COVID. I mean, most of us think COVID's over, but it's not for the NHS. We're in the middle of a flu season, which is one of the most horrendous flu seasons I think we've seen for a long time. And of course, on top of that, we've got the disruption of the strikes. So when you get that kind of disruption in the system, it has a knock-on effect So if you take something like a scan, if the hospital is preoccupied with scanning people who are already in hospital, who've been admitted, then there isn't the capacity. And this is a word we're going to hear a lot this afternoon. The NHS doesn't have the capacity to deal with the problems. And there's lots of reasons for that, and we'll no doubt talk about them later on. But this is a capacity issue. There should be enough headroom in the system to say to outpatients who want a scan, come in. But at the moment, the capacity is full, really, by inpatients.
Yeah, absolutely. And I'm sure you know about sort of figures for the number of physiotherapy jobs that are vacant at the moment. Now, interestingly, we've mentioned already postcode lottery. This is not a story that I would recognise as a patient journey from my practice, because where I work, we have what's called a community musculoskeletal service. So actually, people see physiotherapists very quickly. They at least speak to them very quickly. And likewise,
some are self-referral.
Absolutely. And likewise, my patients do not wait 3 or 4 months for a scan on an Achilles. It's actually quite quick. Yes, they might wait for surgery, but the process would have been started. So again, this is back to the fact that we have areas where we have a really good gold standard of care, but there's no mechanism for other areas to learn or to copycat those services.
Yeah, Tony, but like when you listen to that, you're a victim of where you live in terms of it's a postcode lottery as to how long you will wait, what care you will receive and when.
Oh, we lost him.
Is Tony still with us?
Yeah, I'm still with you, yeah.
Yeah, Tony, you know, that must be very frustrating to hear that it's a postcode lottery. Essentially, you're a victim of where you live.
Yeah, I mean, it's terrible, isn't it, when you think about it? Because, I mean, I only live 2 miles from the local hospital, so I could go anywhere to get care. I would go anywhere to get the treatment, and that's what I've had to do with my hips over the years. And obviously, it's a shortage of staff, isn't it? You know, there's no way that I can get an appointment with the physio at the local hospital, which are employed by the NHS. I mean, this private
to go into other areas for treatment. So could Tony say to his doctor, look, I'm not getting any joy with the hospital you've recommended me to. I've been on a waiting list of 2 years. Sure, can I go somewhere else?
Patient choice, you can choose to go somewhere else. Of course you can. But what happens here, and you must see this a lot, you know, a scan is a scan. You know, it's a picture. So what's the scan for? Is it for a diagnosis? Yes, it is. Okay. To diagnose what? Well, if you've got a ruptured Achilles tendon and you can't get about, then clearly that scan should take priority over a scan that's just maybe checking, I don't know, post-operative or you know, it's a way of prioritising the scans and it exists, Sarah Jane. The difficulty we've got is the NHS is so busy at the moment, the whole lot seems to me to have imploded.
Yeah. OK, we've been talking about waiting times, and we've also been talking a lot here on Sky News about response times, ambulance response times. Sky's Becky Johnson has been at the West Midlands Ambulance Service Control Centre for quite a few days now. She's been out and about with the teams as well. It's in Dudley. And Becky, what's happening right there right now? We keep hearing about these lengthening response times. Talk to me about your experience there in the control centre.
Well, they are still very busy. Of course, the pressures this winter have been unprecedented. We know that. But nationally, we've heard today that the waiting time at hospitals, that ambulances are having to wait before they can hand over to A&E, has fallen slightly on last month. And that's what we're seeing here at West Midlands Ambulance Service. I've got the latest numbers. Last month in December, the longest a West Midlands Ambulance Service ambulance waited outside a hospital was 32 hours and 57 minutes. Quite extraordinary. Now, this month, the longest is 11 hours, 57 minutes. So quite an improvement. Now, I'm told there are a number of reasons for that. Firstly, they're seeing fewer cases of flu, fewer cases of COVID, and thankfully fewer poorly children with strep A. But they're also doing things in the hospitals. So speaking to the paramedics here, there are now advanced paramedic teams in some of the busier A&E departments across the Midlands who have set up essentially in spaces within those A&E units, working alongside healthcare assistants from the hospital so that ambulances can hand over patients. And these advanced paramedics could be looking up to around looking after around 12 patients at a time, so they haven't quite been admitted to hospital, but at least that ambulance can then get back out on the road, because of course the worry is that there are simply no ambulances left to respond to Category 1 calls because they're all queuing outside hospitals. Now, they're working all the time here with the live data on the walls, and just a brief look at that. Basically, the more green there is, the better. The more red there is, the more worrying. You can see it's a bit of a mixed picture today. I've got some live data on this iPad here that's telling me that at the moment the longest wait an ambulance has had outside a hospital, there's one ambulance at Shrewsbury Hospital that's been there at 2 hours and 16 minutes. Another ambulance at the same hospital has been there 2 hours and 10 minutes. I mean, you know, we're talking about things getting better, but better than really bad isn't necessarily good, and ambulances should be handing patients over within 15 minutes. Well, looking at this data, there are at least 6 ambulances in the West Midlands that have been waiting outside A&E departments for over an hour and are still waiting there. So still the pressure is acute, but perhaps just not quite as bad as last month.
Oh, Becky, thank you, Becky. There with a snapshot of what's going on inside the West Midlands Ambulance Service call centre. You can only imagine the pressure in that centre when they're getting calls in and they're trying to find an ambulance that's free to get to those emergency calls. Let's hear from Carol in Sheffield. She's got a good story for us. Her dad broke his leg last week. He was seen and sorted, including a trip in an ambulance, inside 5 hours. Carol, tell us more.
Yes, exactly. He's 90, bless him. He fell on the ice last Friday, and it was about 9:45 in the morning. Mum called an ambulance. I wasn't there. We don't quite remember how long the ambulance took to come, but no one was standing around saying, "Where's the ambulance? Where's the ambulance?" So that was 9:45, and about 2:30, I got a call from one of the senior nurses in Resus in the accident emergency department. And that's 2:30. That's about 5.5 hours, actually. And they do live a long way away. They live 12 miles away from the hospital, so you have to add that on as well. Pardon me. He called me to say that Dad was comfortable, that he'd been treated for his pain, that he'd had all his X-rays, he'd had all his blood tests, he'd been seen, obviously, by the nursing staff and assessed. He'd also been seen by the accident emergency doctor, a lovely lady called Frances. And I spoke to her again as well as this nurse, and they'd already made his diagnosis. They had a preliminary care plan intended at that time, and he didn't actually go straight to the ward, but it wasn't very long until he went onto the ward. Following that, that was Friday. He had his operation on Sunday. Yes, his operation on Sunday, and all of his treatment has been absolutely brilliant. It's all gone really swimmingly. The nurses on the ward have been fabulous, and we can't praise them highly enough. And okay, in the olden days, 5.5 hours might have seemed like a long time, but let's be straight and let's give some credit where it's due to people who are still managing to do a fabulous job, because they must get very demoralised when they hear negative stories the whole time.
Yeah, 100%, Carol. People always want to talk more about the bad things than they do about the good things. That's just the nature of us as people, isn't it? But when the NHS gets it right, it is the best in the world, Roy.
It's what Ellie was saying earlier. You know, it is patchy. It's not horribly bad everywhere, and it's not super good everywhere. There are differences.
It might be good sometimes, bad at others.
I mean, this is classic. The operation was well within the NICE guidelines, and this is how it's supposed to be done. But it depends a lot. There are a lot of other factors. I mean, first of all, there's the demography of the area where the hospital is. Does it have a lot of very elderly, frail people? Like, for example, along the south coast, there's a higher incidence of elderly people there. So that makes a difference. It's where the hospital is, and you often find hospitals who are in coastal areas find it very difficult to recruit. And so that's a problem if they don't have the staff. And so there's a lot of compounding factors that sit outside the hospital that impact what happens inside the hospital. And just going back to the report we had about the ambulance service, the flu, the numbers for flu are starting to drop. And what we find with flu epidemics is they're a slow burn to start with, and then they compound, and suddenly you're swamped with people with the flu. But when it burns itself out, they drop off a cliff. So hopefully we might be seeing the end of the flu.
I mean, I would say that story we heard, I would say, and obviously I'm biased because I work within the NHS, I would say that is more common than people
more the
having...
norm.
I would say that is more the norm than people having a bad experience. So in my GP surgery, we take Google reviews and NHS Choices reviews, and the majority of them are incredibly positive, both regarding the clinical staff and the administration staff. And I would say that, as you say, you know, bad news makes headlines, and people talk about sort of those issues much more. But the majority, because people working with the NHS want to do a good job, sure. We in the main are practicing gold standard care within sort of the limited resources that we have. And I would say that in the main, we have good experiences.
No one comes to work to keep people waiting or to do a bad job.
I'm just thinking back to Tony we were speaking to from Preston, who's been waiting 2 years for that ankle scan.
Yeah.
And the issue of fairness in terms of, we mentioned postcode lottery. How is it fair that somebody in your area, Ellie, gets 5-star treatment, great reviews on Google for the hospital or the GP surgery? Someone in Tony's area is having a terrible time, whether it's getting a GP appointment, having to go in an ambulance and waiting for hours, sitting in a corridor.
So that's partly to do with what Roy mentioned, which is really interesting, actually, about the demography of staff around the country. So I'll give you an example from my own personal life. So I work in a GP practice, which is really, really good. I'm a patient in a GP practice, which is really not good, actually. And the person within my family who's got a chronic condition, we've taken them out of that GP surgery and put them in one half a mile down the road, registered there, so we can get that person very good care. And yet the GP surgery at the bottom of my road, I don't get good care. Now, that's the same demography, it's the same area. Yeah. And there is this terrible, patchy service.
It's all about shopping around and doing your research. You know, we do that in other areas of life.
People don't change doctors, you know. All the evidence is, if you look at the numbers, you know, once you're with a GP, you stay and you just kind of put up with it.
But should it be that way? Should people be a bit more proactive?
No, absolutely not. I mean, you know, we should have one of these websites where you can...
TripAdvisor.
Yeah, TripAdvisor for health. But I mean...
Well, I think more tools are becoming available for people to see how their GP is doing, whether it's league tables or reviews. Right, we're going to leave it there. Just a reminder of the number to call, 0208 167 2200, to have your say on the NHS today. Good and bad. We want to hear all stories, whether you work within the service or whether you are receiving treatment from it. Later tonight, there's a special debate here on Sky News on the huge issues facing the National Health Service. We'll be asking, can the NHS survive? It's this evening right here on Sky News at 7 o'clock. Well, still to come here on our NHS special phone-in programme. We'll be taking more of your calls. Coming up next, what do you think of the continued NHS strike action? As I said, get in touch, 0208 167 2200. That's the number to call.
There's always more to the news than a headline. We want to discover, to delve a little deeper, to find out what's really going on. Explanation, analysis, the people at the heart of every story. I'm Neil Patterson, and this is the Sky News Daily Podcast. Alex Crawford joining us now from Ukraine.
Their personal possessions are all scattered around the place.
Our economics and data editor, Ed Conway, try and make sense of the big numbers for us.
Things can change incredibly quickly, and that's what they have done.
So, by the end, we'll hopefully all understand what's going on in the world just that little better. Available wherever you get your podcasts.
Welcome back to NHS Crisis Your Say. All afternoon here on Sky News, we are taking your calls and giving you the chance to share your views on the state of the National Health Service. Don't forget the number to call today if you want to have your say here with us on the show, 0208 167 2200. Right, let's get back to the calls. We're now going to talk about the ongoing strike action within the health service. No end in sight to that. More dates announced for February and March. Let's talk to Vincent. He is in Birmingham. He's a retired consultant geriatrician. And Vincent, you don't support the strikes. Tell us why.
Oh, thank you very much. Let me say that it is not that I don't support the strike, and it's not that I don't support the pay increase for the hospital workers. What I am against is the timing. I retired as a consultant geriatrician in September 2021. While I was in service, we were always complaining about inadequate remuneration for the work we do. And at that time, we were actually considering going on strike and all that. This time, I am against the timing of the strikes because the government we have now in place, the government of Rishi Sunak, is virtually a new one. Last year, we had 3 prime ministers all in one go, and he is here. So far, I'm not convinced that he is doing wrong. In fact, I am satisfied with his plan of action to revamp the NHS. And I think because they are new and because they are just settling down, we should allow them time to settle before we begin to go on strike.
Vincent, you do know what people are going to be saying at home. Some people at home are going to be saying, look, you know, Rishi Sunak might be new, but the Conservatives aren't new. They've been in power for over a decade, and we've had Prime Minister after Prime Minister promising to boost the NHS, to invest in the NHS, to bring it up to where it was. But in the last, 10 to 12 years, the NHS has deteriorated. So the government isn't new. It might be a new Prime Minister, but it's the same government.
Yeah, I agree. I do agree. But he appears to have a new sense and a new way of doing things from what he has outlined. I still think that we should give him maybe 1 year, 2 years to see how he does.
Do you think he should talk to the National Health Service workers who are striking? Because what we're hearing from those on the picket lines, and I know you don't agree with these strikes necessarily, the timing of them, but what we're hearing from those on the picket lines is that the government won't even engage with them. They won't even talk to them about their demands, not their demands, their asks, whether it be about pay or conditions. They're not engaging. Do you think Rishi Sunak, if he is shiny and new and getting to grips with it, he should sit down and talk to them, actively engage with them about pay?
Yes, I am not Rishi Sunak's spokesperson. What I understand Rishi Sunak did was to set up a pay review committee that made some recommendations, all of which he accepted. Every one of us, we are all adults, every one of us knows that this government, as it is now, doesn't have much money. The nursing staff started by requesting a pay increase of 19%. He can't, I don't think, in my knowledge, I'm not an economist, but I don't think he can give them that and give the ambulance drivers and give the border agency workers and everybody. That will lead to severe inflation in this country, and we'll know what that will amount to. That is what I'm saying. Yes, I agree. He should talk to anybody who has a reason for wanting to go on strike. He shouldn't avoid them. He should talk to every individual. That is part of his job description, I'm sure. But in terms of everybody expecting the money they are demanding in this current circumstance, I think it's a very hard ask
Yeah,
That's my impression.
I get it, Vincent. If you give in to one, you have to give in to all. Like you said, so many people on strike at the moment. We're only talking about the NHS today. You know, you've got railway workers, you know, teachers considering going on strike. Gosh, you know, the Environment Agency. There are so many people going on strike at the moment. I completely take your point. Give in to one, you have to give in to them all. Let's talk to Gavin from Kent. Gavin had a stroke and had an amazing experience within the NHS, and believes that the NHS staff should be paid more. Gavin, first of all, how are you? Talk to me about your experience.
I'm not too bad, thank you. Funny enough,
That's
my
good to hear.
physio's just left my house.
What was that, sorry?
I said, funny enough, the physio's just left my home about 10 minutes ago.
We caught you at the right time
You
then.
caught me at the bang on the right time,
yeah. Talk to me about the experience you had in hospital then. Why are you such a big fan of the treatment you received?
Me and my wife was in London up the West End on a night out for our anniversary, our wedding anniversary. All of a sudden I started feeling ill and I went over like a tree, and she realised I was having a stroke and she phoned an ambulance. They was there in like 3 minutes. Within 20 minutes I was having care, medical care. Fortunately enough, we was right on top of the hospital. Within half an hour I was having proper care. So I had an acute stroke, but it saved my life. And then I can't say the word for it. I had to do a cranioscopy, which means they took half my skull off my head. So they've done that. I don't know who's ringing me in now.
I mean, Gavin, you know, you said it yourself, you owe the NHS your life. So for you,
I do owe me life.
Money is no object. Talk to me about some of the staff that you met and how they looked after you.
I've been in 5 hospitals.
5?
And, yeah, 5 in total. And I think Richie Sunak should go and pack an overnight bag and go in an acute stroke unit and watch how many jobs the nurses have to do in an hour. And see it with his own eyes, personally. Or one of the MPs, go in there and take a bed for the night and go and have a look. And go and live it a little bit.
Only 25% of nursing shifts are fully staffed, according to the Royal College of Nursing. So they're working under tremendous pressure.
I mean, the nurses that I see are running around doing 5 jobs at a time. And like I said, I thank them all because I think they've been absolutely brilliant in the NHS. Personally, that's my experience, and I think we should find them money and give them money.
Yeah, I mean, Gavin, you're not alone. You do hear from so many people who have had, whether it's life-saving treatment or, you know, bringing new life into the world in a maternity unit. You know, people have so many positive stories about the NHS.
I've got nothing but good to say, personally.
Yeah. Yeah, no, I can fully understand why, Gavin.
Very quickly for me.
OK, well, let's get a sense now of the pressure on NHS staff and the reason that they have launched this industrial action. Paul Turner, paramedic for the North West Ambulance Service. He's also a Deputy Branch Secretary at the GMB Union. Paul, that's just one of the many positive stories we're getting here at Sky News today on our Your Say programme. People value the NHS and, you know, a lot of people say you can't put a price on, you know, saving lives, but actually you can when it comes to paying staff properly and enabling them to work in better conditions all round. The NHS, the staffing needs investment. That's why you're striking.
Yeah, so the strikes are based on 2 elements. The first element is about the public safety, and the second part is about the 10 years of austerity faced by NHS workers. And I appreciate we are not the only ones on strike, but I can only talk about the NHS because that's what I work for, that's what I'm interested in. And, you know, we miss other very important services out there that are not eligible for strike. But again, from this government, we're awarded pretty much nothing as a pay rise because gas, electric, mortgage rates, rent rates, they all go up, but our wages never match inflation. Now, I'm not saying we deserve an inflation-busting pay rise, but it needs to at least match inflation because of the 10-year austerity that we've experienced. You know, I listened to Vincent, the first gentleman that was on, and I you know, I don't agree with what he's saying. There's no right time to take a strike. Nobody in the NHS ever wants to go on strike. We're here to look after the patients that we serve. But every single day when we're trying to do that, because of the underfunding and the lack of resources we've got, we are failing every single day. And now it's come to a point where enough is enough, and NHS staff can't carry the burden any longer. People are waiting hours and hours for ambulances, which is not acceptable. There's often, when I'm at work, my colleagues are at work right across the UK, where we're hearing our radios pinging saying there's category 1 emergencies outstanding whilst we're stood outside corridors or in a completely different area to where we should be. It's not unusual for me to travel an hour and a half to an incident on blue lights and sirens to get to someone who needs us, because there's no resources available in that area. And that's because of the amount of under-resourcing that we're facing. You know, it's really stressful at the moment in the NHS. You know, you don't get a break from it. Your 12-hour shift or your 8-hour shift can turn into 14, 15 hours easily. You're lucky if you get anything to eat or drink during your shift because you stood on corridors. And that poor patient, when you've gone home, is still sat potentially on that corridor or in your cold ambulance. And you come back in the following shift and the patient's still there because they've not moved. That is not acceptable at all moving forward. I hear people saying there's no money for, you know, pay rises, things like that. But we managed to find money for MP expenses, for instance. They claim more in expenses that the 999 callers get paid working for the NHS, taking those 999 calls. It's just outrageous that we're carrying on in the way we are. And now we are struggling to recruit into those areas because other service providers, other jobs are paying more than what you can working for the NHS, which fair play to them because they're looking after their workers. And yes, people could say, well, leave the job. If you don't want to do it, go and work there. But then who's going to do the job that I do? And one of the other things that really frustrates people is how degrading it is being called an ambulance driver. I'm a highly educated medical professional. I've done 3 years at university to obtain a degree, like all of my colleagues have. And even our EMTs and dispatchers and call takers and everybody else across the NHS, you now need to have minimum qualifications to be eligible for those roles. So to be called ambulance drivers, I think it's a bit of a kick in the teeth, and that's coming directly from the government.
Yeah, Paul, I can sense the frustration in your voice. You know, you're living and breathing this, and you know, a phrase that I heard earlier this week. You know, people aren't dying because NHS workers are striking. NHS workers are striking because people are dying. Is what you're talking about?
Yeah, that's correct. A recent GMB survey, our members believe that patients are now dying because of the delays. That's not me saying that. That's, you know, 20,000 GMB members across the ambulance service saying that. You know, we are facing this every single day. And, you know, I don't want to be on strike. Every day I'm on strike, I lose pay, and rightly so, because I'm not providing that service. However, I will never get that money back. And rightly so, I won't get that money back. But I'm doing it because otherwise, my children won't have an NHS because it won't be here. We cannot get staff. We are massively underfunded and massively under-resourced. And I'm not going to get onto how badly we're treated through the COVID pandemic. We didn't even have suitable PPE, which again, we're wasting millions and millions of pounds a year storing it out of date in a warehouse.
Paul,
It's just unreal.
Paul, do you have to remind yourself why you still do this job? Why do you still do it?
I do the job because I love helping patients. There's nothing better than saving someone's life, you know, delivering a child, you know, preventing that potential death when you get there. There's nothing more rewarding than that. And that side of the job, I absolutely love. And that's why I continue to do it. But the politics behind it, it's just, we've had enough. I cannot stress it. Our members have had enough. I've had enough. People are leaving in droves. We cannot recruit because you can work elsewhere and get more money or the equivalent for less stress. It's all the stress that you take home with you. You go home after 12, 14, 15 hours knowing that that patient's still going to be sat there in the morning. It's just not fair and it's not right. And I, again, listened to Vincent about giving Rishi Sunak a chance. No, we've had a Tory government now for too long. We need a change. Not very political, to be fair. Not really interested who gets there, but we need to have a change. We need somebody in power that actually cares about the public.
Paul, thank you. Stay with us for just a moment. A really impassioned conversation there with Paul. We could just feel your passion for the NHS service and your frustration about what you're going through. As you said, you studied for 3 years to do this job to save people's lives, and you're not able to do your job properly. Let's speak to Jason in Newcastle now. Jason was in a motorbike accident and spent 5 months in an NHS hospital. Jason, what was your experience in that hospital? Because what I can see from the notes my producer has given me, you feel like a lot of money and time is wasted in hospitals.
I would have to agree with you there, Sarah. Like I say, I was there for just over 5 months in hospital, and I was between 2 hospitals. So I was initially airlifted to a Scottish hospital where they carried out the surgery and things like that. And then I was transferred to an English hospital to be repatriated closer to home. Now, the first thing that comes to mind anyway is the fact that it was cheaper to use a private ambulance than what it was to use an NHS ambulance, which I thought was staggering. So that was out sort of straight away. Now, when I was part of in the English hospital, the hospital, I would say, a lot of wasted money. Now, I'm from a timber frame background in the private sector, where things was basically a production line, and you had to work for what you had to get. Now, in the NHS, that I'm led to believe anyway from staff when I was in hospital, that when you take a day off from work, you're actually paid for the day off from work, and you just don't receive your shift enhancements. Whereas in a regular job, you would lose your first 3 days and things like that. So there would be a waste of money for me anyway. So you'd be paid everything by your shift enhancement for going to work, but you don't actually turn up. There was ward managers and things like that which were taken, from what I believe anyway, from my research. So they were like grade 7 or band 7 or band 8, £43,000 a year plus. Walking around, I don't know what their situation was, but they were basically tearing pennies off, using PPE and things like that, walking around asking patients how they were doing, then tearing it off again and putting it in the bin, and then carrying on walking around. I was thinking to myself, right, well, I don't understand what your purpose is exactly within the hospital, so I don't see why you'd be paying £43,000 a year for you to be doing what you're doing. I don't really understand with that. I ended up having a few meetings with the ward manager on my particular ward about how staff were behaving, how, for instance, there would be 4 sisters on a ward, 2 nurses and, say, for instance, 3 carers to look after the patients. Now, on my ward, it wasn't a particularly busy ward, so I can't speak for the whole hospital. I've got no doubt that in other wards, things are really busy. Like what your previous gentleman was saying about the stroke ward, I've got no doubt that it's a really busy ward. But on the ward that I was on, you couldn't get staff for loving their money through Monday to Friday. But yet when it came to a weekend when there was enhancements, so time and a half rates of pay and double times for a Sunday, you couldn't get moved for nurses on the ward, So I've got to think to myself, there's another amount of money that doesn't need to be spent.
OK, Jason, well, what you're talking about is accountability, and you did the right thing. You asked questions. You asked to speak to the ward manager about what you were seeing, and that's probably a good example to set in terms of asking questions, whether it's about your care or the environment you're in within the NHS. Let's quickly speak to Anthony from Chessington, who's been hanging on. Anthony, I'm really sorry to hear you had a seizure 2 weeks ago, and your ambulance wait went from 2 to 9 hours, so you went back to bed and woke up with concerns over a cardiac arrest. What happened?
Basically, what happened is I had a seizure, and I was in the hallway, and I had a seizure in the hallway, and my wife had to call for the ambulance, and then basically he's waited for quite a while for the ambulance to come out. And when they came out, after quite a while, they came and did test on me and said, yes, basically your symptoms of having a heart attack. And they took me to hospital, and I was still waiting in the ambulance for quite a while because the lift on the back of the ambulance stopped working, and I was stuck in the ambulance for quite a while as well. And when the people came and said, we can't take you out of the bed in case you do have a cardiac arrest, you're going to have to wait in the ambulance. And then when I got into the hospital, I was waiting for 5 hours before even anybody come and did any checks on me, anything, basically.
Anthony, it must have been an extremely worrying time for you and your family. I'm just going to bring in Paul Turner as well, from the North West Ambulance Service, a paramedic, a GMB Union Deputy Branch Secretary. I mean, Paul, these stories will not be unfamiliar to you. You know, you experience them day in, day out, and I appreciate you staying with us because I know you've got to go and do the school run because, you know, you work and you have a family. Talk to me about how all of this is affecting you personally, because, you know, we talk about pay and conditions, this is your work life, but, you know, how much is it affecting your day-to-day life, your personal life?
It's very difficult. It affects all of my colleagues exactly the same. You know, you can't really arrange anything after work. So if you due to finish at 7 o'clock in the evening and you've got to get your children, you know, our partners might work night shifts because we're on days, so you're working opposite. You can't guarantee you're going to be home at 7 o'clock because you might then be stood in the hospital for another 4 or 5 hours. So it becomes a lot of stressfulness that shouldn't really be there. Listening to those poor individuals there that have experienced such bad care by the NHS, not the staff, but because of the under-resourcing, it is just not acceptable. It really isn't. And, you know, I put hand on heart tell you now, none of the NHS staff want to be on strike. We really don't. We want the government to get round the table, give us a plan of how the NHS is going to look in 2 or 5 years' time, and also talk about pay. We need to understand what the government are going to do moving forward. It cannot carry on like this. And I fundamentally believe that we are privatising the NHS through the back door. I know every single day we put out private ambulances every day responding to our calls because we don't have enough staff. We don't have enough people there. So they have to bring in private providers.
Paul, we have to leave it there and you have to go. Thank you so much for talking to us about your experiences. We'll have more calls after the break. Hello, this is NHS Crisis Your Say. I'm Sarah J. Mee with a special programme here on Sky News this afternoon, getting your views on the state of our National Health Service. Hospital waiting times are the longest in history, with thousands of surgeries cancelled as the health service struggles to cope. Ambulance response times are the slowest on record, and crews are spending entire shifts parked outside hospitals waiting to offload patients. A poll suggests a third of people are unable to book a GP appointment, and the 111 phone service is facing unprecedented demand. With the NHS on its knees, industrial action is spreading in a deepening dispute with the government. Do you support the striking workers or disagree with their action? And if you have a positive story to share, we want to hear it. Whether you work within the NHS or you want to talk about the treatment you've received, we want to hear from you this afternoon. To have your say, call 0208 167 2200 and you could be on air with us this afternoon. Well, good afternoon. You're watching NHS Crisis Your Say. Today, Sky News is launching a special project. It's a year-long project with two leading think tanks to try and find solutions to the crisis that is currently gripping the health service. Well, all afternoon, we're going to be taking your calls and giving you the chance to share your views about your National Health Service, good or bad. We're going to get into the calls in just a moment, but alongside me in the studio, we have Roy Lilly, who is a health policy analyst and former Vice Chairman of West Surrey and North East Hampshire Health Authority. Alongside Roy, a familiar face to you here at Sky News, Dr Ellie Cannon, GP and author. Don't forget the number you need to call this afternoon if you want to have your say with us here on Sky News. It's 0208 167 2200. We are going to get back to the callers. Amy is first up. Amy is from Essex. And Amy, we're going to talk in part about staffing in this portion of the phone-in and your experience of having a baby within the NHS. Tell me about when you nearly had the baby.
So originally I'd planned to go to a midwifery-led unit, but sadly during the pregnancy, the unit actually got closed down because there were staffing issues. So my closest hospital is an hour away, which obviously is a bit of a concern if there's anything wrong with your baby or you during labour. And then luckily it did open just prior to, but because of the staffing issues, they had to do it on like a day-by-day basis. And then I ended up having to go to my main hospital, which was an hour away. Sorry, that's my toddler.
OK, I can hear said baby in the background. Who's she? What's their name?
She is Lily. She made quite an entrance into the world, bless her, because I was, like I say, ended up having to go to the hospital, but because I'd not been there for any appointments, they didn't have anything to say, like, if you're ready or anything like that. So I was sent to a day assessment unit rather than the maternity ward, and I ended up actually nearly having her in the corridor because there wasn't anywhere for me to go.
Oh, my word. Well,
yeah.
We're thankful that this story has a happy ending. I can hear Lily, nice and lively in the background. That's good. We like to hear that.
She's not quiet.
Have a happy ending. But, Amy,
Definitely.
That's quite concerning, you know, in terms of you having to go to a hospital an hour away, you didn't know where to go, you're wandering around the hospital. Throughout your maternity care, what had it been like up until that point? Because obviously we hear about a shortage of midwives and the pressure they're under as well within the National Health Service.
I was told you're meant to have a named midwife, which is what they tell you at your booking appointment. I never actually saw the same one. After I'd had her, I was due to be stitched up, but I was actually left for about 3 hours after having her between getting stitched up due to a shift change. But the lady who did end up coming to do my stitches apologised profusely. It was no fault for her own. She was very honest, which I appreciate. She just said, I'm really sorry, we're so understaffed and everyone's worked out that you get more money and less responsibility by becoming an agency member of staff. So when they do a changeover, rather than it being like a half hour, this is who's who, this is where's where, it took them a lot longer and obviously people slipped through the cracks.
which is not what you need after
No.
just giving birth. I'm going to bring Roy and Dr. Ellie in on this.
Yeah.
I mean, there's so much to unpack from what Amy's been talking about. From you are meant to have a named midwife, and anecdotally, that doesn't really happen that often, even though it is meant to happen. And then a whole unit having to be closed down because of a lack of staff. How does it get to that point, Roy?
There's not enough midwives. We haven't trained enough midwives. There's not enough midwives. We have fewer midwives per head of population than most comparable healthcare systems in Europe.
And is that because of what we're hearing in these current strikes? It's conditions and pay?
Yeah, look, I think Paul hit the nail on the head when he said, well, why are we here?
Paul was our paramedic that we spoke to before the break, yeah.
I mean, after we've got to cast our mind back to life before COVID, to the World Banking crisis. After the World Banking crisis, the NHS had pretty much flatline funding, under 2% uplifts a year. The NHS needs at least 4% to run up the down escalator, to keep up with ageing populations and developments, innovations, all that kind of stuff. So we had 10 years of flatline, very slim funding. We didn't recruit enough people, train enough people, build enough hospitals, get enough beds, innovate enough. All of that wasn't done. We went into COVID, and we forget this, we went into COVID with waiting lists at 4.5 million. And I remember coming to Sky talking about 4.5 million people waiting, and it was a record, and how it was, never happened again. And then, of course, we had 40,000 nurse vacancies as well. It was all building up at that time. Then along came COVID, everything was thrown up in the air. Now we're hopefully, in inverted commas, coming out the other side of COVID. The chickens are coming home to roost because we don't have enough of anybody. If you look at international comparisons and you compare us with what's called the EU 14, that's the OECD countries, per head of population, we have fewer doctors, nurses, beds, diagnostics, scanners, you name it, than most European countries. And that's when the damage was done. Now we're trying to cope with a huge surge in demand, and we just simply don't have the people. And that includes midwives. And you're absolutely right. The gold standard is one mum, one midwife all the way through. It very rarely happens, unfortunately, because we just simply don't have enough people.
Let's bring in Ezra from Lincoln. Ezra had pancreatic cancer, but had an amazing experience with the NHS. And Ezra, you had to undergo various operations as well. Talk to me about your experience and the level of care you received.
Yeah, I can't praise the NHS enough. It's absolutely outstanding. The care I received at my local Lincoln United Lincolnshire hospitals was outstanding and professional to the nth degree. I've had PSA testing before, and I know doctors aren't all that keen on them, but the benefit of the PSA test is where it shows a spike. And previously mine was 0.3, 0.4, which is nothing. I was complacent, but then after COVID, after Bill Turnbull's death, it just made me think again about having another one, and this time it came back at 8.7. From the GP, from the nurse at my local GP surgery who took my blood test, to the GP who immediately he got the result of the test, said, phone me up, asked me to come in the very next day and did digital rectal examination, and then put me immediately onto the 2-week cancer care wait straight away. I was seen within 2 weeks at my local hospital. I had an MRI scan. I've had a biopsy. I had a bone scan. I met the urologist who talked me through the whole procedure, taught me through where my cancer was in my prostate, and luckily enough, it was still contained. And I also saw the oncologist to see all options that were open to me. And then the option was for me, and I said, could I do it after Christmas? We went in on the 6th of January in my local hospital. I didn't have to go anywhere else. A £6.5 million machine had top of the surgery, and I can't praise enough. And the nurses from everybody at my local hospital, from Katie, who was one of the nurses that saw to me, through everybody. I remember one night, about 3 o'clock in the night, and the nurse came up to me, and I think it was a 10-bed ward, and all the other men were sleeping. And she came very quietly with her little light on, so as not to disturb me, just did my blood pressure, my oxygen levels, and I remember thinking then, well, where's government now? These people, they're not heroes, they're professionals, and I really can't praise them enough.
Yeah, that's the gold standard level of care that
It's
you
cancer.
were talking
You can't
about.
mess with
Roy.
cancer. You have to get on, do it, and that's a classic how it should be done. And I thought it was when Ezra, wasn't it, was saying they're professionals, they're not heroes. I mean, the staff, you talk about vocation, they say, yeah, maybe, but, I'm a professional and I do a professional job, and that's what I want to be known for.
Yeah, they don't want to be clapped, they want to be backed.
Absolutely right, and I think there's a real difference. I think I should clarify, actually, because we introduced Ezra as having pancreatic cancer, and it sounds like he's actually had prostate cancer. But I think that it's important that people realise, because the difference we've had with people with having ankle injuries versus something like cancer, and maternity versus something like cancer, there have been flagship services like the 2-week wait, like the stroke services, where there have been huge amounts of investment, huge amounts of media interest, huge amounts of political interest, which again has added to this patchy service. So thankfully, we will have stories, and I'm so pleased to hear it from Ezra, of that absolutely gold standard service from his blood test going up all the way through to the treatment, versus somebody who's got what is perceived as a non-urgent ankle injury and is really, really suffering.
It's not urgent to anybody else but them. And that's what we forget. You have to start with the patient and work backwards.
Yeah, that's the thing, that all the statistics, all the numbers involved, it's
the NHS does have quite an interesting programme. It's called the GIRF programme. It's called Getting It Right First Time programme, and it's very successful because it does look at the gold standard and try and introduce it across the NHS, and they're making quite serious headway, I think, in trying to equalise the way in which people are treated throughout the country. The NHS is really, it's a patchwork of
it's so huge,
individual organisations.
Yeah, exactly.
The trusts themselves are statutory standalone bodies. They're independent. That's the result of the Thatcher reforms, which in terms of management was a good thing, but in terms of standardising care, it's really quite difficult.
It's made it extremely fragmented. Well, Ezra, we're so pleased to hear that you're doing well.
Thank you, Ezra,
and so
story.
nice to hear good words about your nurse Katie, and I'm sure all the other members of staff that you encountered, whose names you can't remember because obviously you're going through a huge ordeal with prostate cancer, but I know that you will remember the faces and remember the care you got for a lifetime. So Ezra, thank you for calling into us here at Sky News. Just a reminder, if you do want to get in touch and have your say this afternoon, 0208 167 2200. Let's talk to Janet now. She's in Lancashire. She's actually an ex-practice manager in primary care. And Janet had 3 spinal surgeries just last year. And because of the problems you had during those surgeries and around your care, you now have PTSD. Janet, this sounds just awful. Tell us more about it.
OK, yes. Hi. I'd just like to say, first of all, before I begin, that I want to emphasise that I've no criticism against any of the doctors, consultants or nurses that dealt with me during the time I was in hospital.
Janet, it's a point that Roy made earlier. It's a problem with the NHS, not the staff that work within it. So, no, you're quite right to highlight that. Absolutely. I feel that they're victims of a failing health service, just like the patients are. But last year, I've obviously got several stories to tell, but one I wanted to highlight for Sky News was the 37-hour wait in A&E that I have. I was only at that time, I just had my second spinal surgery. I'd had two spinal surgeries in 14 days, and I'd only just been discharged. And 2 days later, I went back in an ambulance because of complications. I was taken into the rapid assessment and treatment service in the hospital A&E department. And long story, but I'll try and cut it short. After about 6 hours there, where I'd had a lot of tests and I'd had a cannula inserted in my arm, I was nil by mouth because they thought I may have to undergo a third surgery. After about 6 hours, I was moved to another part of A&E, which at this stage was absolutely overflowing with patients. I'd been taken in at 6 a.m. in the morning, and this is probably about midday, and I felt so sorry for the nurses and the doctors. Patients were on the hard trolley beds.
Some were just on chairs waiting. It was honestly, it was dreadful. There weren't enough staff to be covering. And I was lucky enough because I was put in a little cubicle which had a door. Some patients were just, screened off with curtains. At one stage I was catheterised, but just left. I had no pillow. I was nil by mouth. And I was in the room just literally on my own. I was in a lot of pain with my back. And, it was very, very traumatic. And one stage during the night, I heard a commotion, and there was a gentleman that had been brought in, and he was drunk, and he'd been beaten up, and he was given abuse to the couple of nurses that were there. And I thought, there's some people who are very critically ill. There was a gentleman in the little cubicle next to me, and I could hear him moaning, and he sounded really, really, really very poorly. And, the nurses trying to deal with all these other situations. During the night, going towards the early hours of the morning, I'd been catheterised, but the nurse had only been able to find a small catheter bag for me. And during the night, I felt like I needed to pass urine, and I realised that the catheter bag was full and it was overflowing. So I'd got urine on my nightdress, on my dressing gown, on the sheet. Also, I tried to take my dressing gown off because it was wet with urine, and I pulled the catheter out. Pulled the cannula out of my arm, partly out of my arm, so that I was bleeding all over my nightdress. I was shouting desperately for a nurse to come and help me, and I got to the stage where I'd managed to sit myself up, bearing in mind, like I say, I was only 8 days post-surgery, and I sat on the edge of the trolley, and I literally started to cry. I felt so miserable and so, depressed and low. I just didn't know what I could do for myself.
Janet,
I managed to get up, and I got outside of the door, and there was one healthcare assistant, not a nurse, not a staff nurse, a healthcare assistant who at that stage was looking after 7 patients. And she just said, look, I'm really sorry, but you're going to have to wait.
Oh, Janet, I'm so sorry to hear about your experience. As you said, it was like a horror movie. And as a result of what you went through, those surgeries and then that experience in A&E, 37 hours in A&E. You came out with PTSD.
It's a graphic example, isn't it, of when we hear about delays. You hear from patients who've experienced that delays and what has happened. And the reason it's happened is A&E is chock-a-block because when ambulances bring people in, normally about 40% of people who are brought in by ambulance have to be admitted and they get treated in A&E. They can't move them onto the wards because the wards are chock-a-block because, as we heard earlier in the programme, we can't get the care packages to get people home safely. So the whole system backs up, and that's a very graphic example of what happens to patients, and it's a dreadful experience for Janet.
But also that delay, something like what Janet's just explained, and in a very human way she's described it, and the emotional impact and possibly the physical impact as well. It's not just the delay there that's the problem. There's then possibly medical issues and ongoing emotional issues as a result. So we're creating ongoing problems which feed back into the NHS, either because of pain or because of psychological trauma, that sort of thing.
And there is a management expression, but it's called failure demand. It's the demand that's created by failure in the first place.
That's the thing, people, well, we've been hearing it this afternoon here on the special programme that, people are going into hospital and having more problems in there, picking up more, coming out with more problems, and that's not why you go into hospital. You go into hospital to get better, to find to get sorted. Let's bring in Fraser from Maidstone, who has had a more positive experience. Now, Fraser, you're a high-risk diabetic. So you've had, experience of the NHS, but you want to tell us a particular story about your daughter?
Yes, I do. Yes, she's 3 years old. About 6 weeks ago, she was in my car going to nursery. Was coughing, coughed up a load of blood. I absolutely panicked because I've never seen blood come out of my little girl's mouth ever. Stopped, pulled over. A lady who was going to work, who was a nurse for the local hospital, She said to me, don't panic. It's probably just a burst blood vessel, but go to A&E and get it checked out. So I literally turned around.
That nurse is never off duty, never off duty.
Never off
never
duty.
panic,
No,
and never panic.
which was awesome, because she calmed me down straight away, because when your little girl's bleeding and you think the worst. So I drove to hospital, went into A&E. Within 15 minutes, I was through A&E into the children's ward, and they said, yes, it's a burst blood vessel because her tonsils are absolutely massive. Got me a consultation within a week with a consultant at the same hospital. And on Tuesday, on the 31st of this month, she goes in to have her tonsils taken out. And that, to me, is better than any private hospital could have done.
You don't get more efficient than that.
No, you couldn't. And literally, I'm a diabetic and I've got sarcoidosis, which is a glandular lung disease. And from day one, the local hospital, for my whole family and myself, have been absolutely incredible. They've never done a thing wrong. You can see they're under pressure, but they deal with it. Literally, I don't know what else I could say. Really, to get in that quick for my daughter, which was a panic for me, and then literally,
that's quite interesting, Fraser, because paediatric A&Es are a relatively new, I mean, not brand new, but they're a relatively new addition to the NHS, where they're specialised with children. And I'm pleased it was only tonsillitis. You'll have to get the ice cream ready. That's
yes. Yes, I do seem to remember that about tonsillitis.
Yes, but no, I can see, I watch the programme, I can see everyone's point of view, but personally myself, I haven't got an issue. There's things we can do to change it. If we all stood up and said, look, I'd quite happily pay more to the NHS. I work 7 days a week to provide for my family, but I would quite happily, if the NHS said, right, we'll take a private programme or subsidised programme to pay an extra whatever it is to help, I would gladly do that.
Do you pay for private care within the NHS, or would you support something like tax rises to fund higher wages for NHS staff?
I don't understand how. I've lived in America and I've seen it from that side as well. If there was a way that we could, if it was attachment to earnings or something, if you had more medical care, I don't know how it would work. It's weird, but you'd pay for what you used in some sort of form. Or if there was a way to do an insurance policy or something. But I would rather use the National Health Service than try and go private, because it's taken the National Health Service people into the private. That's right. You look at the programmes, you read the stories, and whether they're all true. Doctors have moved to Dubai because they're getting more money to work privately than they are in the NHS. Now,
you feel like something's got to give, more money's got to come from somewhere, whether it's people paying privately or through taxes.
I don't think it's just not money, because the industry that I'm in, I speak to police, we speak to ambulance drivers and a lot of hospital staff, and they are so passionate about their job, more passionate than probably I am about my job. But
there is a debate, coming probably for the next election and how we pay for the NHS. We pay through taxes here. Some people talk about social insurance. Look, I mean, you take your taxes out of your left-hand pocket and your social insurance out of your right-hand pocket. It's still your trousers. You still have to pay. And the cheapest, cleanest, quickest way to pay for the NHS is through our taxes. Well, but as we found this afternoon, we haven't paid enough in our taxes, and that's why we're in the mess we're in.
And this government doesn't seem particularly keen on putting taxes up. Let's now get a nurse's perspective. So we're going to go from patients to the other side. We're going to speak to somebody who works on the front line and has taken part in the recent strike action. She is Antonia Berylson, a specialist nurse within the National Health Service. Antonia, thank you so much for taking the time to speak to us here on Your Say this afternoon. You've been listening to some of the calls we've had, and different experiences, vastly different experiences, different ends of the scale. Some who have experienced wonderful care within the NHS, and others who have had such a traumatic time they've developed PTSD. What's it like as a nurse working in the NHS at the moment?
Working as a nurse in the NHS is really, really tough. We're seeing the managed decline of the NHS over successive Tory and coalition governments. The NHS is one of our proudest institutions. The eyes of the world are upon the NHS, and essentially it's being failed. We need to put money into employing the staff, paying the nurses and the doctors and the physiotherapists an adequate wage, and to ensure that it carries on looking after the health of the nation, because essentially the NHS ensures that people are healthy, are working and contributing taxes, which in case then goes to carry on the NHS services. And it really is breaking my heart as an NHS nurse to see us having to be on the picket lines, because we've spoken out for decades. And as Pat Cullen says, patients aren't dying because nurses are striking. Nurses are striking because patients are dying, and enough is enough. We are standing here as the natural advocates of our patients and saying something has to change.
Antonia, more strike actions come in February and March. We're looking at February the 6th, the biggest day of industrial action in NHS history. Nurses going back on strike, other workers joining you on that day. And to be frank, the government, from what everyone, negotiating from your side is saying, the government doesn't seem interested in negotiating more money from the NHS. From what we understand, the NHS budget has already been set until 2024, 2025. The government, take advice from the pay review body, and it seems to be set in stone. Do you feel like this strike action will have any effect?
Just to make a note that the independent pay body is not independent. What we need to have on the independent pay review body is union members from the RCN, from various other unions. We need to have people on the ground adding to this decision, number one. Number two, we need to make changes. There's only one solution to this crisis, is to encourage the staff to be retained and encourage staff in. And unless we're paying an adequate wage, we are one of the world's largest economies, yet nurses, university-educated nurses, are relying on food banks, are having to make the difficult decision whether to heat their homes or whether to eat. It's worked out they're working a shift a week for free, and it's simply not sustainable. It's all about political choices. The government had plenty of money on the failed track and trace and dodgy PPE contracts. It's all about political choices.
Yeah, Antonia, I just want to put something to you that a caller, I think it was Vincent from Birmingham, who we spoke to earlier on in the programme, and he said, look, if the government gives in to nurses, he has to give in to ambulance workers, he has to give in to Environment Agency workers, rail workers. So many people are on strike at the moment because they feel that the pay they do for their job isn't enough. The whole country is in the middle of a cost of living crisis. Vincent's argument seemed to be, look, we're all going through it, we're all having to make sacrifices, and the Prime Minister can't give in to everyone. There isn't enough money.
Let me just reiterate, it's all about political choices. During COVID, no one could question the integrity of the nurses, of the doctors, of the ambulance drivers. We were risking our lives, and we were applauded on the doorstep by the politicians. Unless we're going to be relying on gesture politics and empty promises, it's essential. And I'm not going to play into that role of, divide and conquer. I'm going to say all essential workers, we all need a pay rise. It is simply appalling that there has been the greatest transfer of wealth from the poorest to the richest. Essentially, we need to ensure that everyone can maintain a good quality of life. Children are living in poverty. We're seeing the increase of diseases that are caused by poor housing. This is not the country we want to be. We want to have fairness and equity. People deserve to have a fair wage. People deserve to be able to pay their bills, not worry about keeping the heating on. And that's what makes our value as a country, surely, a healthy population that's paid adequately. And just to reiterate, this is also about pay restoration, because we've had, as a profession, over 10 years of pay freeze. And we are a safety, a profession that is ensuring the safety of people's lives. I don't feel that we should be questioned on that, insofar as we deserve to have a fair wage.
Perhaps I could sort of speak to just something that, Antonia's just said. I mean, she's a specialist nurse. I'm not sure if the public realise what that means. Specialist nurses are palliative care nurses, they're cancer nurses, they're nurses who are looking after people at the end of their lives, going into homes, looking after children with special needs. I mean, they are doing work that deserves to be paid well. And I'm not saying this in a political sense, I'm saying this in the sense of we undervalue these people who are so important individually to our lives. And I know as a GP, if it wasn't for specialist nurses within the community, we wouldn't be able to look after our patients the way we do. We're all part of this team, and the public are hugely reliant on specialist nurses.
You're right. And what Antonio is saying about pay restoration, if you look at the data, over the last 10 years, they've lost 20% of the value of their wage packets because of the erosion. But the difficulty is, of course, 6 million people are on the government's payroll one way or another, and a quarter of them are on pay review body reviews. And once you unpick one pay review body, you've got to unpick the rest. And that's really why I think the government are trying to kick the can down the road with this. They're going to push it down to April. In March, inflation, it looks like it's coming down. In April, the pay review body for the NHS starts again, and they'll push it into September.
OK, well, Antonia, thank you so much for joining us here on Sky News. Antonia Barros, and a specialist NHS nurse who's been taking part in recent strike action. There is strike action happening today. Thousands of NHS physiotherapists in England are the latest group of health workers to go on strike in this dispute over pay. Physios and their support staff at 30 NHS services, 1 in 7, are currently staging a 24-hour walkout. It's the first time members of the Chartered Society of Physiotherapy have gone on strike. Let's speak to Sky's Saba Chowdhury. She's at St Thomas's Hospital in central London. Saba.
Good afternoon, Sarah Jane. As you say, this is the first time that the Chartered Society of Physiotherapy, its members, have walked out in its history. So something like 4,200 people join these members behind me here. That's across 30 different trusts in England, and they're striking today, and they're striking on February the 9th as well, and February the 7th, I should say, in Wales. Now, one of their chants that really sort of encapsulates what it is that they're calling for is, well, you can hear it you can hear it yourself.
What do we want? Fair pay! When do we want it? Now! What do we want? Fair pay!
Fair pay is what the members of the Chartered Society of Physiotherapy are calling for. They're saying that they simply cannot afford to do their jobs anymore, that there isn't enough staff, and that the retention levels of employees in hospitals is significantly low, and that a pay offer needs to be attractive in order to retain people in the hospitals. They're also saying that they are, as I mentioned, struggling with the cost of living crisis that is impacting so many of us in the country, and they're positioned here rather poignantly, I would say, right in between the Houses of Parliament, right outside St Thomas's Hospital, calling on Rishi Sunak, the Prime Minister, I'm sure you can hear, asking him where their taxes go. Their demand to government is loud and clear. They want a pay review that's in line with inflation, that to them is fair, and only then will they stop striking.
OK, Saba, thank you. NHS workers out, come rain or shine on those picket lines. Coming up on NHS Crisis You'll Say, we're going to be taking your calls on social care. You can get in touch with us this afternoon. 0208 167 2200 is the number to call. Welcome back. You're watching NHS Crisis Your Say. All afternoon we're taking your calls and giving you the chance to share your views on the state of the National Health Service. Don't forget the number to call if you want to have your say on the programme this afternoon, 0208 167 2200. Right, let's get straight back to the calls. We're going to talk in this section about social care. And joining us on the line is Stuart, whose son had to wait 8 hours for an ambulance and ended up going to hospital in a police van. Stuart, tell me more about your son and his experience.
OK, let me tell you the story. Thanks very much for me to give me the opportunity to talk this afternoon. We have a son with complex special needs. We live in a rural area, OK? He has autism, a diagnosis for autism. He also has a diagnosis for a thing called Prader-Willi syndrome. Now, Prader-Willi syndrome is a chromosomal condition. And that condition basically means that the person who has it eats almost constantly or has the desire to eat almost constantly. We have to therefore keep an eye on his diet. He has learning difficulties. And late in teenage and early 20s, where he is now, you can also find himself in a situation where he becomes highly anxious over things, and that can actually sort of bleed over into psychosis. Something happened at the college he goes to, something very small in early September. This led to a massive anxiety attack on his part. His mental health disintegrated really over a period of 24 hours. He made an attempt on his own life. We called an ambulance, we called the police, because we were worried about his safety and also ours, because he's 19 years old and he's a big lad. We waited, I suppose, for about 10 minutes for the police and about half an hour for the ambulance services. The ambulance service were great, the police were great. Unfortunately, when they spoke to the mental health support people, all they could offer was a diazepam tablet and see what happens overnight. We waited overnight. A night wasn't very long. He only slept for a couple of hours. It took ages to get the diazepam tablet into him. The following day, he was really no better. We rang the mental health support line. They suggested a particular service in our area called the Autism Intensive Support Team. We rang the numbers for them. The numbers rang dead. The support team as such at this moment in time does not exist, or certainly didn't at the time that we tried to access that service. We found ourselves in a situation where he wasn't improving at all during the course of the day, and we found ourselves having to ring the ambulance and ring the police again. The police arrived very quickly. The ambulance, we were told, was going to take about 8 hours to arrive. Police looked at him, looked at us, looked at the situation, and said, right, the only way we're going to sort this is to get him into A&E in the local hospital, general hospital, which is 25 miles away. And so you had a situation where you had a young man of 19 with learning difficulties and his dad being taken to hospital in a police van. We were there we got to the local hospital. We were quite quickly triaged, thankfully. He was put into a cubicle. We had 2 police officers with him who were there just to look after his welfare. We were told then, myself and my wife as parents were then told to go home because we were exhausted, and that he would be assessed for his mental health, and that we would be told what the situation was as soon as they knew. We got home, which is a 25-mile-an-hour journey, and we were more or less told that we needed to come back in again because the police were wanted on for other duties, which is understandable. During the time he'd been in hospital, in the cubicle, he had become agitated and somewhat aggressive, and the police felt for their own safety they had to handcuff him. He was then sedated. He was sedated then for about 4 days, and then he was brought home. 3 days after being brought home, they had what they call a blue light meeting, where about 8 different people over Microsoft Teams spent some time, in principle at least, exploring what to do with him. We found ourselves in a situation where pretty well all of the people involved in the meeting really didn't quite know what to do, and were all almost making excuses not to help him. It was the most ridiculous situation I've ever known. They got someone in from outside, a doctor from another service, a psychiatrist, to come and see him. That person wasn't even in the meeting. As things currently stand, our son is in reasonable but not brilliant psychological nick, but we have no services for our son. If this happens again, then we go back into the same merry-go-round. All we may well get is diazepam tablet, a little bit of advice, and then we have to wait until it explodes to a situation where we have to go back into A&E. The services are simply not out there for him, and it is an absolute crying shame.
Oh, Stuart. Well, first of all, I'm so sorry that that support isn't there for you, your wife and your son. I mean, social care is what's needed. Instead, you're using ambulances, going to A&E and the police. And sadly, it's a story we hear all too often, because that care and support isn't there for you. Stuart, stay on the line. I'm just going to bring in Will. Will is in Chesterfield and has a son with disabilities, has an advanced care plan, however, has had an experience in A&E of a 24-hour stay. Will, talk to me about why you're in A&E for 24 hours.
Yes, so my son had respiratory problems, and he was taken to the local district hospital in an ambulance, but he does have the advanced care plan and requires HDU level care when he's poorly. This plan was written by the NHS, and it explains all of this. But when the ambulance took us to the local district hospital, they had real problems trying to locate a suitable bed space for him. So we ended up spending 24 hours waiting in a side room in the A&E. We were essentially fending for ourselves. And eventually they decided to admit him to a general ward within the local hospital, which wasn't suitable for a child like him. And if I could just explain that the ward couldn't feed him because it didn't support his specialist diet. It couldn't escalate respiratory support, and he was in a real mess. And it couldn't even use his own ventilator that we'd taken from home due to a lack of trained staff, or so they told us. In fact, they did tell us that he was unlikely to even survive the admission. So he was sort of helplessly sat in a district hospital when he should have been in a HDU setting. And we eventually spent 9 weeks there. And I was doing most of the care myself. I couldn't leave the hospital because I was the only one who could feed him. And the whole experience was absolutely awful. We're most concerned that it might repeat again in the future because he did have an advanced care plan which was completely disregarded on this occasion.
Well, how's your son doing now?
Yeah, well, he did survive the admission. So that's obviously excellent, but he's doing a lot better now.
Yeah, well, largely testament to you, his dad, by the sounds of it, stepping in and filling in the gaps. Not that you should ever be put in that position, but such is the state of the NHS that we're hearing about. Let's just listen to a voice message now that was left on this topic earlier, and this is from Carlo. Carlo is from Hitchin in Hertfordshire. Carlo has suspected Parkinson's and was taken to hospital after falling twice.
I spent a night in A&E on a trolley, which wasn't pleasant. I didn't know what was wrong with me. I had a neurological condition. I couldn't get it tested in the hospital. But when they discharged me, I had a bowel disorder. I had my leg, which was hanging off by now. Very painful with hip and knee problems. I came home and I was on social care. But the social care was charged. They offered me £28 an hour for a sixth former to wash my dishes. My parents died in the pandemic, and we were still sorting out the probate. Because of the probate, I was disqualified from social care unless I was prepared to pay, which I wasn't prepared to do, in principle, and also for financial reasons, but mainly in principle. I'm living alone and coping with my medication, which has run out twice. I just trying to stave off the advancing squalor of living alone when you're sick. I went to see about the leg about 15 months ago, and I've had it scanned twice, and they said you need an operation, but the operation's it's elective surgery. I'm on the waiting list. I'm one of the 7.2 million on the waiting list. Courtesy of Mr. Johnson, and the lack of planning about the post-pandemic situation.
Well, Carlo from Hertfordshire there, telling us his story. Thank you, Carlo.
That poor man is deeply troubled, isn't he, with multiple needs, which is clearly in the bailiwick of social care, social services. But, you know, we keep repeating the same argument. There are 160,000 vacancies across the care services, mainly because they don't pay enough and people can go and work elsewhere and earn a lot more. The social care is such an important part of the delivery of health services. The health services can't do what they need to do.
Well, the rest of it doesn't seem to be able to work properly if
social care gets completely clogged up if you can't move people through the system. And this poor man, whoever he is, I mean, it's clear he's going to end up as an admission, or he's going to end up, you know, with some drama at home that it doesn't get sorted out. I mean, we talked earlier about failure demand, the demand that's created by failure. You listen to that, that's going to cost a fortune to sort out.
That's going to be ambulance, A&E,
you know,
bed,
ambulance £300, A&E at least £500, bed £300 a night, and you can just check it all up. You know, for what really?
With the two
for what is small change for getting it sorted out with social care.
And with the two parents who we heard talking about their kids, both in sort of quite different situations, we heard about sort of great ideas in practice. Somebody had an advanced care plan, somebody had a Microsoft Teams meeting, all great ideas in practice and these flagship ideas which come across me in general practice as well. The reality is, if you don't have the personnel to take the responsibility or to activate these things, it's all very well having an advanced care plan, but if you end up in a hospital where they can't work your ventilator...
Let's bring in Professor Vic Rayner, CEO of the National Care Forum. Professor Rayner, you'll have been listening to those callers and to Roy and Dr Ellie in the studio here. Social care is not in a good state.
No, I mean, you know, I think that the challenges I heard Roy just mention there in terms of the level of vacancies that are there, in terms of the pay terms and conditions that are there, I thought, and the last caller who called through and talked about the impact of having to pay for their own care. So we were also in a situation where large-scale government reform had been promised and committed to by the Prime Minister and by the Conservative government, and that has been delayed as well. So, you know, it's a really, really difficult situation. And I agree, you know, that there are all sorts of challenges for people who are currently in hospital or being admitted to hospital about getting access to social care. I think we're not talking enough about the need for people to have that social care at a much earlier stage to prevent them ever having to get to that acute stage, to enable them to have the support, whether that's about home adaptations, whether that's about regular kind of engagement from social care staff, to mean that they don't have to fall into crisis in order to access help. It's a really frustrating, it's a terrible situation to be in as an individual. And if you are trying to make sensible strategic decisions about what needs there are in your community, if all you can do is tackle people once they're at the point of crisis, you know, we're just going to be on a constant merry-go-round of people, you know, feeling failed, and rightly so, feeling failed by both health and care. It's hugely frustrating.
We're seeing now the government has given the NHS two tranches of money, 250 million, to buy places in care homes to move 13,000 people out of hospital who don't need to be there.
The emergency measures that
exactly.
the Prime Minister
and that
announced.
came out of that weekend meeting at number 10, which is fine. But first of all, you still have to do an assessment. You still have to move 13,000 people. When you do that, another 13,000 are going to come in and fill the beds up. And more importantly, and this is the essential point I think Vic touched on, is that if someone's in a care home and they're expecting to go home, they still need a care package to get them home. So all we've done is push the problem out and hope that it will resolve itself, and it won't, because you still have to have that interface between domiciliary care and residential care.
Professor...
Well, I was just going to say, I think the other bit of it is that money, that, you know, everybody always welcomes money when it comes along in that sort of, but it's so short term. I mean, if you want to try and change the dial on this, we should be having this conversation now about March 2024, or not saying we've got 200 million now, you've got to spend it in the next 8 weeks, and then you fall off a kind of cliff edge because there's no further money available. So I think it's just, you know, I mean, I slightly sort of challenge some of that kind. You know, there are some fantastic provision within care where rehabilitation can go on. So for some people, it will be the case that they can go into a care setting and within a fixed period of time they can return home. But not everybody's the same. Lots of people will continue to need care beyond that, and many people will continue to need to stay within a care setting because they've actually got to such a crisis point before they went into hospital that their ability to remain and living independently was compromised before they ever entered hospital. And there's a lot of work that needs to be done to support them to build back up. So alongside care, you need to have all that wraparound assessment, as Roy says, but also access to occupational therapists, physiotherapists, and a much wider community support.
And when we've dealt with that 13,000, Vic, we've got another 13,000 that have come into those beds. And you're absolutely right.
We've got 500,000 people who local authorities can't even get out to assess. So we don't even know what their needs are. We don't even know where they sort of sit on that list. And yet, you know, I think that not all
this
of the
whole social care
people,
piece is
they're not all down. 13,000 people are not being delayed by social care alone. Let's be really realistic about that. I mean, the figures that were given out pre-Christmas about the sort of change in terms of the number of people who are being delayed is moving from sort of 10,000 that are regularly delayed and up to 13,000. So let's be really honest about where the kind of delays sit in the system. And, you know, there are a whole bunch of reasons why, but for nobody, I mean, I don't think anybody would sit around the table and say it's a good place for somebody to stay in hospital longer than they need to.
All right, Professor Rayner, CEO of the National Care Forum, we really appreciate your time here on the programme this afternoon. Let's bring in Christine. Christine is from Shropshire and is a former NHS employee in a social care role. Christine, talk to me about your experience and your overall view and assessment of social care in this country at the moment.
OK, well, that part of the problem is this is a legacy issue that goes back to the split between health and social care under a previous coalition government in 2012. It's a legacy problem and it hasn't addressed the issue. Until we address the issue of social care, none of the rest of the things are going to follow. I totally agree with the previous guest speaker. We have to get that right. And she also mentioned about trying to stop people getting to the crisis situation. That was my role until last year as a community and care coordinator within a GP's practice. The whole idea was to try and keep people independent in their own home and put in packages of care, whatever it was that was needed to support them, so they didn't get into that situation where they needed to be in hospital. The trouble was, latterly, before I left last year, was it was very difficult to try and get these social care packages put in place. But there was a whole host of other things, just as the person was talking about, aids and adaptations for people to enable them to remain in their own home, arrange bus passes, heating for their homes, etc. So there was a whole host of things that, as a care coordinator, we would try and do for people. Unfortunately, since I've left, having been told there was no funding for my role going forward, the patients at my practice have no one to look after them now because nobody was employed to take my place, which I find is a great shame because we helped to ensure that GPs' appointments were freed up for clinical need and we managed the social need.
Christine, thank you. Thank you for your call. I just want to squeeze in Brian, who's waiting patiently. Brian's in Cheshire. What do you want to say, Brian?
Hi, my story is about my mum. Last year, she collapsed at home and she had a 3-hour wait for the ambulance, and then she went into hospital for 2 to 3 days. She still wasn't eating after the 3 days, but then she was sent out, and I pulled up to the hospital, taking my dad, who's 93, to see her. And then we got a call, and she was just completely hysterical. She'd been taken to a care home, and it hadn't been communicated to her properly. And she thought she'd been put in a hospice and she would never be getting out and going home. But she's never been like that before, so she's not the kind of person that would get hysterical. It was horrible to see, you know. But then when we went to the care home to see her, we went from the hospital to the care home. We couldn't get in because of COVID. You know, you couldn't get to see them for so many days.
Ryan, listen, I'm sorry to interrupt your story. We have got to take a break, which is really unfortunate. But can you stay on the line and we'll talk to you after that?
Yeah, no problem at all, yeah.
Thank you, Brian. We'll see you in a second. Thank you. Welcome back to NHS Crisis Your Say. I'm Sarah Jane Mee and we are in the middle of a special programme for you here this afternoon on Sky News. We want your views about the state of our National Health Service. Hospital waiting times are the longest in history. Thousands of surgeries have been cancelled as the health service struggles to cope. Ambulance response times are the slowest on record and crews are spending entire shifts parked outside hospitals waiting to offload patients. A poll suggests a third of people are unable to book a GP appointment and the 111 phone service is facing unprecedented demand. With the NHS on its knees, industrial action is spreading in a deepening dispute with the government. Do you support the striking workers or completely disagree with their action? And if you've got a positive story to share, we'd like to hear it, whether you work in the NHS or you want to talk about the treatment you've received. We'd like to hear from you on the programme. To have your say, call 0208 167 2200 and you could be speaking to us here on the show this afternoon. This is NHS Crisis Your Say here on Sky News. Today, we are launching a special project, a year-long project, with analysis from two leading thinking tanks to try and find solutions to the crisis gripping the National Health Service. Well, this afternoon, we are taking your calls and giving you the chance to share your views about the National Health Service. Before we get back into those calls, just a reminder of who's in the studio alongside me. We have Roy Lilly, Health Policy Analyst and former Vice Chairman of West Surrey and North East Hampshire Health Authority, and Dr Ellie Cannon, GP and author. Just a reminder of that number to call if you want to have your say on Sky News this afternoon, 0208 167 2200. Before the break, we were speaking to Brian. He was talking to us about the treatment his mother received during the pandemic. Brian, apologies for cutting you off. You understand how it works here on TV. We have to go to those breaks. But please, pick up from where you left off before the break.
Yeah, so we got the call from Mum. She'd been put into the care home, so we dashed from the hospital over to the care home. We couldn't get in because of the things that were happening to keep people safe from COVID, but we were able to talk to her through a window and calm her down. But she really had to go to get to eat again until she could walk upstairs, because she lived in a house that was upstairs with no downstairs bathroom or bedroom. So when I spoke to the care home, I said, well, she needs this physio. They said, well, we don't have any physio capability, no people, no equipment. And this happens time and time again. We get people sent out and we haven't got the equipment for them. And I rang the hospital and I spoke to the physio that had worked with Mum before she was sent out. And she convinced me that she had a proper plan for Mum and everything. And I said, well, how can she go out to somewhere where it can't be put in place? And she said she didn't know what was happening with her, and she would pass it on to her manager. But after, she still had no appetite for days, and then she had severe constipation. And in the end, I asked her home to get a GP to speak to her because she wasn't getting any better. After a week, they couldn't even get a telephone appointment at the care home, and I managed to get Mum's own GP, and he sent her some constipation medication through. But however, that evening, the care home sent her back to A&E again, and she was told she'd get a CT scan to understand the root cause of the problem. But after 2 to 3 days, she was sent back to the care home without any scan. And I rang them and they said she would be called back in for an urgent CT scan within a week. After a couple of weeks of no call, I rang the CT department and they told me it'd been marked as routine instead of urgent, their error, but she would need to go back onto the list again before she could get this scan. Before the appointment even came through, she became ill again and she was collapsing, and the care home sent her back to A&E, and this was the last time. Then she got this, after a few days, she got the CT scan and was told that she had bowel cancer with a large tumour. When she asked if they could remove it, the doctor said the consultant would not operate because it was risky, and they were measured on the success of their operations. So I spoke to the doctor and asked to speak to the consultant, and he said no, but he would speak to the consultant because he thought Mum was very sharp mentally, and he wanted to go around that loop again. Because of this change, the doctor said it was actually the consultant's choice, not the family's, as it had been the family's choice in the past, a couple of years previously. And then after a couple of days in the hospital, Mum got COVID, and she was put in her own room. We were visiting, we had to wear visors, gowns, and Mum and Dad couldn't communicate because of the visors, and they couldn't really hear each other because of the visors, as they were both reasonably deaf. And partway through, a nurse walked in with no equipment to see Mum, and she just made a joke and said, I keep forgetting they're coming in without this equipment. And she was joking, and then she was, doing something for Mum. Then she was off to other wards then, where people didn't have COVID. And I just thought, this is awful. If this is how Mum's got COVID, and then she passed it just at the end of the 11-day cycle when the COVID had gone and she was able to take the equipment off. She was treated by palliative care, and they gave her something to put her straight to sleep, and she never recovered, never spoke to us again after that. And she died on that last day of needing to, getting rid of the equipment. She actually passed away that night. So it was a pretty torrid experience, to be honest with you, and I appreciate the chance to speak to you about it, because it is quite therapeutic telling someone about it,
Yeah, Brian, it's important to talk about it, and we're so sorry for what you had to go through. Be interested to hear your thoughts on what could have helped your mum in terms of, you know, we're in the middle of strike action now. Nurses going on strike for the first time in 100 years. You know, biggest day of NHS strike action coming up on February the 6th. What do you think could be done to help the NHS and those who access it for treatment?
The big thing for my mum was a couple of years ago she'd had something similar. She'd gone in for 2.5 weeks to the hospital, and they got after a week they got her eating again, and they got all the physio equipment. She was up and down the stairs, and then she went back home, and we managed to get another 2 years with her after that. This time it was very clear they just didn't have the time, they didn't have the beds, they just wanted her out as fast as possible. For whatever those reasons are. But the thing was, putting her into the care home, and they haven't got the equipment, and she went out with a physio plan for somewhere that she couldn't get that treatment. It sounds like, a couple of years ago when people began sent to care homes with COVID, it's almost like we need to get them out, and we'll do whatever we need. So I think they should. I think the nurses and they should be paid market rate. I think, I'm assuming a few years ago they were paid market rate, and then with all the issues with inflation and stuff like that, cuts, it's obviously gone below market rate. But if someone said just giving the nurses 10% is going to make a difference, I don't think it will. It'll reduce, I'm sure, people leaving. But it needs an end-to-end review. You know, these people stuck in ambulances. You know, one of the times Mum was sent back from the care home, she was overnight before she got back into any kind of a ward. She was in an ambulance. She was in corridors. She was 91, with late stages of bowel cancer, unbeknownst to us. It's just not human that people get treated in that way. So I think it needs to be looked at end to end. And of course, paying people market rate is a part of that, but it's nothing like the full solution to fix this, because it does feel it's broken to me. And there are some wonderful people in there. My wife had a brain hemorrhage, level 4 bleed, a couple of years ago, and she was treated magnificently, and she's with us now, and the treatment's been fantastic. So it's not just all bad, my experience, but I do want to see it fixed, because I don't want to see other people's mum and dad going through this kind of problem.
Yeah, we echo that. Brian, thank you so much for coming on to talk to us here at Sky News.
When there's pressure on beds.
Yeah.
All of that story results from the pressure that there is to discharge people to free up beds.
But also it's what you said earlier, which is it's that interface, it's those cracks in the pavement between the two very different services. Brian's mum had a care plan for discharge. She had a physiotherapy care plan, and that wasn't activated when she was in the community.
Yeah. OK, Brian, as I said, thank you so much for coming on and telling us your mum's story, and also your wife's as well. Good to know that she's doing well. We really appreciate it here on Sky News. If you want to have your say here on the programme, 0208 167 2200. We're going to discuss GPs now. Dr Ellie knows a thing or two about a GP practice. New figures out this afternoon show the number of permanent GPs in England has fallen year on year for the 7th month in a row. Let's go straight to a caller. I know you've got plenty to say about this, Dr Ellie, but our first caller is Chris. And Chris is from East Riding in Yorkshire and has never had an issue with getting a GP appointment in his area. People watching this afternoon, Chris, will go, lucky you. Talk to me about your GP surgery and the level of access you get.
Yeah, good afternoon. I started really with the NHS doing a GP probably about 2016 when I got diagnosed with cancer. That's another story. But more recently, and since then, to be honest, as a family, we never have a problem with obtaining a GP appointment within a relatively short time frame. There's various options. You can ring in the morning. You might get put on hold for a little bit, but you always get through. If not an appointment that day, certainly within a couple of days. They have emergency slots at the end. We can also book online. So there are additional appointments where we can register, book online, and that's actually quite a bit quicker than telephone call. And my personal experience in terms of what happened recently was I presented with a back problem, which I'd had since November sometime. I was seen within a day of calling, but I'd had a couple of symptoms that when I presented those to the doctor, raised his eyebrows, to be fair. He pushed a button in terms of he suspected I may have had a couple of TIAs, which are mini strokes, as they're known in the medical world. And from there on in, the treatment was fantastic. The following day, contacted by a consultant from the stroke clinic. That afternoon, I was into the local hospital, MRI, carotid artery scans, ECGs, bloods, etc. I got the results with the following consultation the following day by the same consultant, who'd also jacked up a CT scan the day after, which all came back fine. So in a nutshell, I'd made the call, been seen and signposted through to the stroke clinic, and it was all done and dusted successfully, thankfully, within 4 days. The hospital, I've got to say, was top drawer. The whole Royal Infirmary was fantastic. Certainly no queued ambulances, clean, happy and helpful staff, and the experience was fantastic, as it has been for the last sort of 6 to 7 years. I don't, it's quite subjective whether or not it's some sort of postcode lottery or whatever. I'm not sure, but certainly in this part of the world and my local GP service in particular, no complaints.
That's good to hear, because we often do hear about people that cannot get a GP appointment, can't even get through on the phone, sit there waiting for 45 minutes just to speak to, the receptionist or a doctor's assistant who said, there aren't any appointments today, call back tomorrow at 8 o'clock. So it's really good to have a positive story to kick us off with. I'm going to bring in Uzma from Luton. Uzma's been a GP for 6 years. Uzma, what do you want to say to us here today on Sky News?
I just wanted to say that GPs are generally very hardworking and resilient people, and they are feeling, I would say, overwhelmed, frustrated with the situation, because they, like yourself, like your callers, are patients as well, and we have problems getting through to our GP, and it's a problem of supply and demand, and there just simply aren't enough GPs. We need more of them. We've been promised more of them. It just isn't coming through.
Yeah, Dr. Ellie, I'm sure you'll echo that. It's supply and demand. It's not the GPs don't want to see you, but there are only so many appointments to go around. And it's as frustrating for you as it is for patients.
Absolutely, and we only went into medicine, as somebody said earlier, to help people and to look after people. When I was applying for GP jobs in 2007, 2008, I had to, I actually wrote on my CV, here's an anecdote for you, I actually wrote on my CV that I had 2 children and I wasn't planning to have any more. And the reason I wrote that is because I know when they employ you, they're not allowed to ask if you want maternity leave or you're going to have any more kids. And I wanted to be employable because it was very, very difficult to get a GP job 15 years ago. Now, and as I said, I work in a very good practice, we advertise for a GP post and we cannot find GPs. Well, we have lost a lot of GPs because of pension crises, because of burnout. We've hemorrhaged at one end of the career, and at the other end of the career, you have huge numbers of junior doctors who opt out of the NHS, who go half NHS, half private, who move abroad. We are just not attracting GPs, so we're about 5,000 or 6,000 GPs short. Roy's going to give us figures.
Yes, I mean, I'll give you some numbers here. The GPs do 30 million appointments a month, 30 million a month, 40% of which are on the same day.
Yeah.
The rest are either video or don't require a same day and could be done, another time in the week. We've lost 600. We've had a net loss of 600 GPs since 2021. We lost 600, and the government keeps saying we've got more GPs in the service than ever before. We have, but they're GPs in training.
Right.
Our net gain since 2019 is just over 700 GPs. There are only 28,000 GPs in the country, under 30,000. That's why you can't get an appointment.
Let's bring in Fiona from Salisbury. Fiona from Salisbury thinks that, GPs are overworked. Dr. Ellie's nodding her head in that. And Fiona, in that, you think that they're making mistakes. Talk to me about your experience.
Hi there. It was quite hard to pick an experience, and I think that's probably relevant to most people that have phoned in, that there's more than one experience. But most recently and most significant, I suppose, I had a GP with confusion, incontinence, loss of function to my legs, and hallucinations. And the GP focused immediately in on the hallucinations because I have bipolar disorder and put me on a very high dose of antipsychotics. I did ask at the appointment to have a urine test because I believed myself to have a urine infection. That wasn't done. A month later, I presented again to my GP, where a nurse received a urine sample from me and ran it. She told me that she didn't think I had a urine infection, despite the fact that I did. And then I heard back from her and she said she'd done her dipstick and that I had no urine infection. I then went on to almost completely lose use of my legs sporadically. I became almost completely incontinent at night. I was hallucinating on the school run when I was picking up my child, taking her into school, and I presented back at the GP being carried in by my husband. And after a very invasive test, which I'm sure the GPs that are listening will know is, the doctor I remember very well turned around and said, "Let's see if that urine infection has cleared up." And we did swear, but I won't swear here. Said, "What urine infection?" And she said that my test result, so they'd sent my sample off to the lab a month previous, and my test result had come back as positive. Something at that point for, I estimate, around 3 months. And it's not even that they didn't diagnose it properly, they just didn't bother to phone me and tell me that that diagnosis had been made. I put in a pretty extensive report to the GP surgery, whose response was to double down, tell me that I was clucking for drugs and remove me from the practice. Now, I, at this point, was under the care of the mental health team. I was under the care of the physiotherapy team. I also have chronic fatigue syndrome. I know exactly what is wrong with me. So I wished to utilise 111 in order to receive my repeat prescriptions, which I had from specialist doctors, without actually enrolling at a GP surgery, because I feel that that should be something that is optional. I believe GPs, in the most part, are doing the job of a slow-loading app very badly. They are diagnosticians. I've been to a GP, they picked up a book and started rifling through it. We live in the 21st century. We actually don't need a person who may or may not of training on your particular condition to rifle for a book and tell us what we need. We should be able to have an application that we can put those details into, and let's face it, you could put those details into an application and it could take 45 minutes.
Okay.
And it would still be more functional than the majority of GP practices.
Look, so Fiona, you've had an awful experience. But I'm just going to give Dr. Elliott a right to reply there about GPs, because, I mean, this is a GP's worst fear, right? Getting a diagnosis wrong that leads to such serious consequences for a patient. And yes, GPs are overworked and mistakes are made. GPs are human beings. But in the main, just how much is the state of the NHS affecting your ability to do your job? That sounds like a particularly horrific case from Fiona.
Yeah, I'm really sorry to hear that, Fiona. I mean, obviously we have situations where if people are overworked, when any of us are overworked, when anybody's burnt out, when you've got 1,000 different things being said to you all at once and you're thinking about all different things because you don't have enough staff on the ground, mistakes are going to happen. It would happen if you were reading the news, it would happen if you were flying a plane, it would happen to anybody, mistakes. And unfortunately, we end up with these situations. Fiona's story, I'm sorry to say, is familiar to me, because a urine sample, you know, we get thousands of urine samples into practices every day. A urine sample result can easily, out of the 50 you might get into one GP surgery, one might get missed. Somebody might forget to make that phone call or forget to document that they need to be phoned. And this is going to happen with the lack of staff. And also, I should say as well that within GP surgeries, we've got a lot of other staff, not just GPs. We have fantastic nurses, healthcare assistants, pharmacists, and our admin staff, who really are the backbone. And they are also leaving the NHS in droves, because they can go and work in retail where there's far less stress for more money.
For patients to keep the pressure up on their GP surgery? Because I know we've had callers on this special programme today and you've said, follow up, follow up. Yeah. If, like Fiona was in no doubt in her mind what was wrong with her, and you know, we've had, again, callers and people get in touch with us here at Sky News. Becky Johnson, our correspondent, was with the West Midlands ambulance, seeing an elderly man who'd fallen over, and his wife didn't call the ambulance because she didn't want to bother them because the NHS is in crisis.
It happens a lot.
Yeah,
A lot of
especially with the elderly.
Elderly people, they just feel that they can't bother.
Calling the GP.
But if you get something like a urine sample, I mean, it's simply... I mean, it's not acceptable, but it's simple to resolve. You just use a barcode system, so it gets flagged up automatically and nothing gets forgotten. But that's investment that's required in the system, and that's what we haven't had for too long.
Let's bring in Clive from Essex. Clive couldn't get a GP appointment, and it resulted in him going to A&E. Clive, talk to us.
Oh, hello. It was just after Christmas. I had a very nasty infection in my hand, which was spreading to my arm. It actually turned out to be a strep A infection. It was diagnosed in hospital. It was worsening daily. I tried to get a GP appointment, and bearing in mind I hadn't bothered my doctor for 3 years, but I couldn't get through at first. I tried. Then eventually I got through, was told, phone back tomorrow, we've got no more appointments. I got in touch with 111 service for advice. I did speak to a doctor on the phone who prescribed me antibiotics, but by this stage the situation was getting so bad that the arm was going black and blistered. I was in terrible pain. That my wife phoned for an ambulance at 4 a.m. in the morning to be told unless I stopped breathing, the wait was 32 hours. Eventually, my neighbour took me by car to A&E, where I was rushed through and admitted. I was transferred by ambulance to another hospital, where I went straight into theatre. I had 3 operations, constant antibiotics. I was very, very ill. After 2 weeks, I was better. I was discharged. It was the best care in the world. A surgeon told me I was lucky not to lose my arm or even my life. So I'm so grateful to the hospital and the NHS for saving me, but I was initially disappointed how bad the primary care was. I don't blame anyone who works in the doctors, the 111 service, the ambulance service. They have to work under these financial constraints, but I might not be here now, or I might only have one arm. It came down to that in the end, and my doctor did phone to apologise once I was home, and she said that that she is just at the end of her tether. She feels like quitting, and you know, it's such a sad situation. I don't want to see that either. But the fact is, if we'd caught this earlier, I might not have had to gone through that experience, and may not have had to have got so ill. But I just couldn't get anyone from primary care to help me. It wasn't there when I needed it, I'm afraid.
No.
That's basically it.
I listened to that, hearing that from Clive, and I'm hearing about, a few patients have mentioned about phoning at 8 o'clock in the morning. So we were sort of more digitalised because of the pandemic, and more tech was put into general practice. And in the practice where one of my children is registered, you don't have to phone up. You can fill out a sort of 200-word form online at any time of day, and then you go onto the triage list, so you don't have to fight with the phones. In the practice where I work, you can do the same thing called an e-consultation. All practices, this is what when we talk about the sort of like patchiness of the NHS, all practice should offer that. Nobody in the country should be fighting with the phones. We should be able to do this.
There should be a uniform system across GP
because it works. Because it works, and it's better for doctors because we can triage, we can read in your own words in that sort of situation what's going on, and it's far better for patients.
Because some GP surgeries now say send us photographs, and they send you a link.
That's
and you
what
click
we
on the
do.
link. And,
absolutely.
They've kind of finally woken up to the fact there is technology. It's worth saying something as well about the ambulances. This keeps coming up. In 2016, the ambulance service first started categorising calls, and they did it because they didn't have enough ambulances and the demand was starting to get overwhelming. So they got category 1, 2, 3 and 4. 1 is like you're bleeding to death or you stop breathing. Category 2, and this is the thing that people find so difficult. Category 2 includes your granny lying on the kitchen floor with a broken hip, an epileptic fit, a seizure, a heart attack. So all of these categories, where it didn't really matter then because the gap between a Category 1 response and a Category 2 response was quite small. But it did give the ambulance to get off the back foot and sort itself out. Now, of course, that gap has widened. And because the ambulance services are so busy and so delayed in handover, we're only getting to the Category 1 calls, and the Category 2 calls are really causing people huge problems.
OK, let's bring in Satya, who is in Wolverhampton, a GP for 30 years and has retired. Satya, and you've never experienced the NHS as bad as this.
That's true. Good afternoon to everybody. Good afternoon, you. And I must say that although a lot of conversation has gone on about access, one of the heartaches is about the fragmentation of services. Let me just qualify what I mean by fragmentation. I have been a GP for 31 years, as you said, and I retired 10 years ago. But now in the last 10 years, I've seen I could, if I needed, I could go to 111 or to emergency, or I could call out of the hours, or I could call GP services within the accident and emergency department. I wouldn't know where to go to. And that's a GP who has been working for 31 years. I pity those people who have to make these choices, because sometimes they end up in the wrong place and then they are shunted out to another place because, no, this is not our choice. You go to the... And when they go to the other place, let's say GP care, they'll say, well, go to your own GP. Well, going to three, four places for one problem doesn't seem right to me, because it looks that this is wastage of valuable resources.
Do you know, that's a really valuable point. It's almost like patients are being given more choice, but that might not necessarily be a good thing when it comes to primary care.
Well, Satty, good afternoon. You're absolutely right. This is the too many front door syndromes. Which front door do you go through? And it is confusing for patients. It's only come about because over time, demand has exceeded the ability to resolve a problem. So we didn't have 111, we just had 999. And if you needed help, you called 999. The problem is a lot of people called 999 for things that weren't really emergencies, so we had 111 put in, which it started out as being, I think, a pretty helpful advice line for people. It went through a bit of a bad period and it's got back on its feet again now. But if you look at if you analyse the 111 calls, so many of them get referred to 999 or get referred to the GP. So
they get a video appointment with a GP in a lot of cases.
Or 111 can now book appointments in our GP surgery, so they hold slots and they don't have to fight with the phones. They can do it on technology.
It doesn't limit demand. It spreads demand and diffuses it throughout the system, and that's where a lot of people find it confusing.
OK, well, we've been hearing a lot about problems and dissatisfaction with the NHS this afternoon. We have asked the government to respond and invited the Health Secretary to come on here to Sky News. He declined, but we have renewed that request for someone from the government to come on to the channel. Earlier, Sky News spoke to Julian Redhead, the National Clinical Director for Urgent and Emergency Care in NHS England, who said that some things are improving.
We're all working very, very hard to work together to try and improve that discharge situation and making sure that we can move patients into appropriate care settings as they recover from their illnesses which brought them into hospital. And I think it's really important that we are understanding there's pressures in all parts of the system here, but the more that we can work together to achieve that, the better we can. And we are seeing some progress in some of the work as we do this with the local authorities, with our community colleagues, to make sure that we are able to move patients through the system, and we'll continue that work ongoing.
Well, this is NHS Crisis Your Say. We'll be taking more of your calls and discussing the long-term future of the National Health Service when we come back after this break.
There's always more to the news than a headline. We want to discover, to delve a little deeper, to find out what's really going on. Explanation, analysis, the people at the heart of every story. I'm Neil Patterson, and this is the Sky News Daily Podcast. Alex Crawford joining us now from Ukraine.
Their personal possessions are all scattered around the place.
Our economics and data editor, Ed Conway, try and make sense of the big numbers for us.
Things can change incredibly quickly, and that's what they have done.
So, by the end, we'll hopefully all understand what's going on in the world just that little better. Available wherever you get your podcasts.
Welcome back. You're watching NHS Crisis Your Say. All afternoon we've been taking your calls and giving you the chance to have your say about our National Health Service. Plenty to discuss. Thank you for watching at home. We have a caller now who's been compelled to call us this afternoon after watching from his home in Hertfordshire. It is Sir Rod Stewart. Sir Rod Stewart, good to hear from you this afternoon. Thank you so much for calling in. What made you pick up the phone?
Sarah, hi. I've been watching the programme all day, and yesterday I went for my yearly scan, which is private, obviously, and I was 20 minutes late, and I phoned in. I said, I'm terribly sorry, I'll be there. Then I was a half an hour late. I phoned in, I got in there, and I said, I'm so sorry, I'm so late. They said, oh, we're not busy at all. We've only got a couple of customers today. I won't tell you where it was, but my point being, this is ridiculous, you know, and I would like to pay 10 for 10 or 20 scans. I don't know how we're going to work this out, and hopefully some other people will follow, because it seems ridiculous that this particular scanning clinic was empty and there are people dying because they cannot get scans. Now, listen to me, I don't need the publicity. You know, I just want to do some good things, and this, I think, is a good thing. And if other people follow me, I'd love it.
Sir Rod Stewart, that's such a generous thing to do. Thank you for calling us, and somehow we'll work it out, because that's such a great offer. And I'm sure, you know, callers like Ezra that we spoke to earlier on the programme here, who's been through prostate cancer. I mean, that kind of generosity is literally a lifeline. You've been through 2 bouts of cancer. What's your experience been like within the NHS?
Well, obviously it wasn't within the NHS. I went privately because, you know, I've got a few shillings, as you know, Sarah. But it was tremendous. But I know darn well this NHS has to be rebuilt. It's been around since 1947. It's got to be rebuilt with billions and billions of dollars. That's the only way we're going to go around it. Okay? And tell Eddie I'll pay for his scan and 10 or 20 others, however much it takes.
Oh, And so, Rod, you know, I know you watch Sky News a lot, and you'll be well aware of all the strike action that's taking place amongst NHS staff. It's continuing into February and March. There's no end in sight. What are your thoughts on what the government should be doing about NHS workers who want decent pay and they want conditions? They want to save the NHS, in their words.
Absolutely. They're not asking for a great deal. I personally have been a Tory for a long time, but I think this government should stand down now and give the Labour Party a go at it, because this is heartbreaking for the nurses. It really is heartbreaking. In all my years of living in this country, I've never seen it so bad. And anything I can do to help, go on the nurses, I'm on your side.
I'm sure you have family members who have used the NHS as well. Like you said, there are people like yourself lucky enough to be able to afford private care, and that's something that more and more people are exploring, whether they're wealthy, middle-income earners, or are just scraping the money together to help themselves or family members. How important is it that we have a health service, a national health service, that is free at the point of entry, from the cradle to the grave, if you like? How important is it that the NHS stays as it is and isn't privatised? Or is that some way of saving it, privatising it in part?
Well, maybe there's somewhere down the middle. You know, if we're going to privatise it, it could become terribly expensive. As for my family, my immediate family and all my kids, I'm lucky enough to send them to private service. But I don't know. This is a bad time for us in Great Britain. It really is. Change the bloody government.
OK. Well, so Rod Stewart, you're making your political points very clear here on Sky News. Do have to point out, obviously, that people do have other views. And, you know, we have had callers on here saying, give Rishi Sunak a chance. They promised to sort out the National Health Service and other issues facing the country. But, of course, you know, the government have been around for over a decade now, which is the counterpoint to this argument.
This private sector thing is interesting because the NHS is has more contracts with the private sector now than it did before COVID. It's making a huge use of the private sector, but because the private sector charges a premium to private patients, and they don't get paid as much for doing work for the NHS as they do for their private clients.
And what we see...
And so there's no great incentive for them to do it.
And what we see with private services, and I've experienced this as well with my own family, is whenever they can sort of cream off the patients who they want to see. So if there is any risk, for example, in mental health services, or if there are sort of difficult cases or when things go really badly wrong, actually people are fed back into the NHS.
But that's it. That is interesting. They've got I think I'm right in saying they've got about 800 operating theatres. Most of them don't have ITUs. So if anything goes wrong during an operation, they have to ring 999.
Roy, bear with me. We do have to say goodbye to Sir Rod Stewart. Thank you so much for calling in. Just a final question, if I may. You've been listening to the programme today. Members of the public calling in, having their say this afternoon. Is there a particular story that's resonated with you?
Every one of them. I must admit, I have the television on the back, on in the background while I'm working on my model railroad. But it's just terribly sad. I'm so proud to be British, and I can't stand it being in this way. So you're doing a great job, you guys, on there. Keep up the good work, and I'm a big fan, Sarah.
Oh, well, funnily enough, I'm a big fan of yours.
Oh, okay, then. Take care, you guys.
My mum's favourite, Maggie May.
Oh, okay, I'll sing it for you.
Wedding.
Wake up, Maggie, I think I got something to say to you.
We did wonder how we were going to end the programme on a positive note today, and so Rod Stewart, you delivered, lifting all of our spirits with a song.
20 scans.
And the offer of 10 to 20 cancer scans for people. We'll get in touch off-air, Sir Rod Stewart, and we'll sort that out. Thank you so much for calling us here on NHS Crisis Your Say. Thank you. You never know who's watching. You never know who's watching.
I'll sit up straight, pay attention.
Yeah, well, to end the show, we want to discuss the long-term future of the health service. We've left the tricky one till last, how to fix the problems that the service currently face. Let's get another caller on, shall we? We will get on Michael, who's in Eastbourne. Michael, your thoughts come to the workers on strike, and you think a pay rise is part of the solution?
I certainly do. I had a triple heart bypass, and the Eastbourne Hospital, who brought me round and then sent me on to the Royal Sussex Hospital in Brighton, were absolutely amazing. The job they do, they show great patience, they put up with all sorts, and, they have to go on strike. Why? The way I see it is did the government not just give the barristers and that a pay rise without any argument? So why are they not giving the nurses a pay rise in line with them? You don't see them at the food bank, do you?
Yeah, I mean, we should point out that, you know, the Health Secretary, the Department of Health, the government say that the door is open. They want constructive discussions with the NHS workers, and they are, in the words of the Health Secretary, listening. If you listen to the unions, they don't feel that the government is listening. Let's bring in James, who is in Liverpool. And James, you're pretty angry about what's going on, and you're angry with the government for their handling of the strikes.
No, yes, I think he should give the pay rise. The nurses, I mean, can I just reel off what my problem with my wife? COPD, crystallising of the heart, gout in both hands, bronchitis, on warfarin, hypothermia, and thyroid problems. Now, we regularly go to the hospital, and the treatment we get is superb. I mean, these people are so dedicated. It's unbelievable. And to be treated by a government is scandalous. And I think the government should back in and have a general election. I mean, I had to go and see my counsellor yesterday, and I only found out that social care in Knowsley since 2010, £144 million. I know a lady who struggles up the stairs, can't get a lift or a walk-in shower because they've had that much money taken off us. Not only Knowsley, other parts of the country, we're all suffering. But this government, I don't know. I'm disgusted. I've never known the country to be in such a bad state, and I'm 75 this year. It's disgusting.
Yeah, I can hear how passionate you are in your voice, and thank you so much for taking the time to call us. As I said, you know, the government will say their door is open. They are talking. Negotiations are ongoing, and they have a plan to save the health service. Let's talk now to Professor John Appleby, Director of Research and Chief Economist of the independent health think tank, the Nuffield Trust. Good to talk to you this afternoon. Where do we go from here? We're looking at strike action, the biggest day of strike action by the NHS ever, coming up on February the 6th. We've talked about how we've got here. Where do we go next?
So I'm sure, as you've discussed, and people who've phoned in, it's in a bit of a hole at the moment. I mean, I don't know whether you've gone through some of the numbers, but we've got something like 40% of people waiting over 18 weeks when the target is 8%, no more than 8% for elective weights. Total waiting list, 7.2 million. Back in January 2020, just before COVID, it was around 4.4 million. About a third of people are waiting over 4 hours in A&E when the target is no more than 5%. I could go on. Ambulance, category 1, average response times, 11 minutes when the target is 7 minutes. Diagnostics, 27% waiting more than 6 weeks when no more than 1% should wait that long. So
it is what it says on the title of, you know, your say today. It's a crisis. The question that we want to throw forward to is what are the solutions? How do we get out of where we've got to?
Well, the general consensus of people who've looked at this in terms of what does the NHS need? What sort of money does it need to provide the sort of service that we would like? Reasonable waiting times, covering changes in the population. We've got an ageing population. It's also growing as well. How much would we roughly need each year? Well, the figure that pops out time and time again is around a 4% real increase in NHS funds each year. The thing is that we haven't been getting that, or the NHS hasn't been getting that. So over the last decade to 2020-21, and you have to exclude the special COVID money, the average per year has been about 1.4%. So just enough to cover increases in the population and changes in numbers of elderly and so on. Last year, a bigger increase, 6%. This year, 9%. But the government plan to reduce those increases. So next year, 3%, and in 24-25, about 1.5%. Now, there's a lot of numbers there, but the point is that the NHS hasn't really been getting the money that most people have looked at this, think it needs to produce the sort of quality service that we need. Now, we're in a different position now, strikes aside. COVID has got a long tail for the health service, not just for people's health. Hospitals are having to work differently to cope with COVID in terms of infection control and so on. That's reduced productivity. But the population is still growing. People are still knocking on whichever front door there is to the NHS with problems and so on. So we're really looking for, I think, more money, probably more than 4% a year on average for the medium term. We're also looking for new ways of delivering services. One of the things that's come out of COVID is the use of remote technology. I've been looking at outpatients. So there are 120 million outpatient appointments each year, a huge number. We used to do about 4% of those remotely by telephone or by computer and so on. That figure has now gone up to about 20 to 25%. Now that may help improve productivity, but I think productivity alone is not going to solve the problem. Where, as I say, when you look at the performance of the NHS and where we're at the moment, it's in a pretty deep hole, and that's going to take time and resource to recover.
And Professor John Appleby, thank you for the moment. As you said, there is investment being put in year on year by the government, but such is the chasm that has been left by underfunding in previous years. It's not enough.
No, you're right. I mean, and John's absolutely right. And we were talking about this earlier. We've had 10 years of flatline funding. The 4% figure is the key figure. And if you look at the annual average since 1946 through to today, it's about 3.8, around 4.4%. So that 4% figure is absolutely right. And the other issues really around growth and what have you sort of fall into that situation. But fundamentally, and it's absolutely true, the government have been throwing money at the problems now, and that's really firefighting. A lot of it's wasted on agency fees and things like that, which is a real waste of public money.
Not cost effective.
It is not cost effective, and it's the difference between funding the health service and investing in the health service. And we didn't do what Germany and France and other European countries did during COVID and after COVID, and certainly we didn't do it during the 10 years after the world banking crisis. We didn't invest in our healthcare system, and that's why the chickens are coming home to roost now.
Yeah, that's a really good distinction to make between funding and investing. Let's speak to Dilys. Dilys is in North Wales and has extremely positive experiences with the NHS, but is worried more people are going private. Dilys, talk to us.
Oh, hello.
Hello. How are you? What is it you want to say here on Sky News this
afternoon? What do I want to say? Goodness me. There's so much gone on before this. I just can't believe some of these stories. I was coming in with, I love the NHS and I have a wonderful experience of it, but it doesn't seem relevant at the moment.
No, Dilys, it's important to highlight the good in the NHS. You know, I've had a good experience in the NHS. I had my daughter, in an NHS maternity ward. There are good stories out there, Dilys, and I think it's important to highlight that because that's why people want to keep the NHS service for these good stories. Yeah, Dilys, we need you. Talk to us.
Right, I do want to keep the NHS. It's absolutely... My hospital, I've had, obviously, during COVID, from 2020, it wasn't good. I got sick with all sorts of things, and the doctors disappeared. You couldn't see them at all, and most of the time you couldn't speak to them either. So they just disappeared. And then we have, from 2020, we had this massive gap thing. But since we've sort of resurrected ourselves after it, and everybody can come out and everything else, then I've had a lot of the stuff that I've been sitting on and waiting, all my problems, I've had them seen to. They're all in a bay and seen to. And the hospital system that I go to, the hospital I go to in Wrexham is just amazing. So the staff and everybody else in the whole hospital is like it's just been built. That's just a look of it. So I've had my problems have been from cancer, possible cancer, which turned out I'm just going tomorrow actually for another checkup, and I'm keeping my fingers crossed. I've had no circulation in my legs, so that was terrible. I had cancer. I had COVID. The first time round I had COVID, then I had COVID again, which left me with long COVID. So I've had other problems, but I just can't fault the NHS and the hospital and the staff. As far as the investment in the NHS, I lived in abroad in Europe for a while, and the system there is I don't know. Have we had a brain drain in England? A brain drain in the UK, because there doesn't seem to be anybody with anything in their head. The government really they come up with the most silly ideas. The last one I heard was to charge people for an appointment with the doctor.
Well, Dilys, not everyone thinks that's a silly idea because, of course, you know, as Dr. Ellie will, I'm sure, say that, you know, if appointments are missed, that's appointments that people desperately need. So some people think charging people for GP appointments is a good way to ensure those appointments are kept and is run efficiently. Dilys, thank you so much for calling. We needed a caller like you. We needed a bit of an uplift. And thank you for watching, everyone, this afternoon. You never know where people are watching. Our next caller is actually in hospital. This is Shirley. She is in Devon. She's in hospital right now and has been for the last 10 days. Shirley, how are you getting on?
I'm getting on fine, thank you.
Good.
Just found out about 20 minutes ago I can be going home tomorrow, so I'm pleased with that.
That is very good news, Shirley. And, of course, you're in hospital in the midst of all this NHS crisis, nurses going on strike, physios on strike today. Have you spoken to any of the staff about what's going on? Do you support them? How's the morale?
Yeah, I support the staff 100%. They have my full backing. They are not getting what they deserve. They are fantastic. It doesn't matter what time of day you ring your bell or, you know, you've got a problem like you could have left the bed or whatever. They've always got a lovely smile on their face and calm and make you feel at ease, you know, and that goes a long way.
Shirley, it sounds like, you know, 10 days in hospital, nobody wants 10 days, but it sounds like the care that you've received there from the staff has really made a difference to your stay because you sound in high spirits.
Yeah, I mean, they saved my life so many times these last 10 years. You know, I hit the criteria with COVID. I, you know, hit all the negative marks because of my size, and they got me through that. Last month I was in with heart problems and they saved my life there. It was serious, you know, and I can't fault them. I even asked my MP to do a shift with them so he could see how they work.
Yeah,
but
you've not been the first person to suggest that here on the programme this afternoon, Shirley. We really wish you well. Glad that you're getting out of hospital. Don't hang around on the phone to us. I'm sure you want to pack up and get out of there as soon as possible. Shirley, thank you so much for talking to us. Shirley in hospital in Devon there. We've only got a minute left. Just a final thought from both of you on where we go next.
We've got to fix social care. That's the important thing. We have to have a workforce plan properly funded and we have to step back and give the NHS a bit of space and a bit of time to get back on its feet, and it will deliver.
Yeah, absolutely. I mean, we need to plan. We've heard so much now today about the fact that we didn't plan. We went into COVID, we were already in some crisis, so the crisis just got worse. We don't plan for our workforce. There's no long-term planning. We need a government who are prepared to plan social care and do these proactive things first and plan the workforce for the next 10 to 15 years.
Yeah, and something we've heard about here on the programme today is not splitting health and social care. One can't work without the other, and the effects that we're hearing have been really dramatic.
The common sense of the people who phoned in. They support the nurses, they understand the bureaucratic mess and listen to the people.
Roy, Dr Ellie, thank you so much for joining us here on NHS Crisis Your Say. We have a special debate coming up for you live from Coventry. That's coming up next. Coventry Hospital. Sky News begins a year-long project to find solutions to this crisis.